So I'm old enough to remember a time when people had no idea that there were gay people in the world. When I grew up in the 70s and in the 80s, I remember sort of kind of knowing that there were gay people and lesbians in the world, but I certainly didn't know any firsthand, or I didn't know that I knew any because of all the people who were closeted. And I remember thinking that sure, there might be the one or two gay people on the planet, but certainly there aren't a lot of people who are gay and lesbian. There were some characters on TV in the 70s. I remember the TV show Soap with Billy Crystal. He was gay and maybe trans, but I might have been too young to really get what that was about. I remember some episodes of All in the Family where they tried to tackle, bigotry with the main guy. He was always bumping up against this bigotry and sort of overcoming it in small ways. But again, I think it just went over my head. I barely understood heterosexuality when I was a kid, let alone homosexuality. So it was a very distant thing to me. But then in college, I entered college in late 1989, and instantly I started meeting gay people, lesbians, and friends of mine started coming out, and it just seemed like in my world anyway, there was a sudden explosion. And then through the 90s, there were characters on TV and more awareness, more advocacy, more politics, more, TV interviews, and just more awareness. And I feel like we are at the cusp right now in 2018, late 2018, almost 30 years later. I feel like we're at the cusp of that when it comes to asexuality. We're just at the cusp of society and people understanding what asexuality is. And I'm guessing that in the months and years to come, there will be increasing talk about asexuality. There will be much confusion. There will be much bigotry. There will be a lot of terrible tweets, and God knows what Trump is going to say about it. But there's pre-awareness, there's no talk. So everyone just either doesn't even know they're asexual, or they have to keep it closeted, or they just have to exist in silent happiness or something. And now as we start to, become more aware of it, it starts to become part of the national conversation, then people start saying, hey, you know what? I deserve rights and I deserve to be treated just like everyone else, and we should have representation in movies and that kind of thing. There's just going to be increasing talk, which I think is progress into the future. And then eventually we will have integrated the ideas and the notions that we should be integrating into our society, similar to the way that we've been progressively integrating ideas into our society about gays and lesbians. We're sort of just after the cusp when it comes to trans people and gender issues. We've got a long ways to go, but we have other examples of how advocacy and progress in our society has helped move things forward, and so I have faith that we'll go through the same process with trans and with asexual people. So today, that's what I'm going to talk about. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor. So what is asexuality? Well, in a nutshell, and I'm going to go into more detail later, but in a nutshell, it's people who are just not interested in having sex. They don't want to have sex. They're just not interested. They're not just abstaining, or they're not just celibate like a priest or a MGTOW or an incel. People who are asexual, they genuinely just don't want to have sex with other people. It's not like they're doing it for some other reason. Some of you might be thinking, well, okay, so if someone doesn't want to have sex with other people, then that must mean that they're abuse survivors, right? They were sexually abused as a kid, and so therefore they don't want to have sex anymore. Is that it? The short answer is no. We'll get into that later. Certainly that can be the case for some, but that is not true for most, and a way oversimplification. But I'll get into more of that later. Others of you might be thinking, well, okay, sure. You have a 20-year-old girl who identifies as asexual. That's just because she hasn't had any good sex yet. Wait till she's 25 or 30 and she has some good sex. Then she'll realize that, sex is good and you don't have to deny yourself such a thing. Again, short answer is no, that's not the case. Certainly that for a small minority of asexual people, that might be a factor, but for the vast majority of people who are asexual, that has nothing to do with it. Having, quality sex doesn't change an asexual into a allosexual person. Allosexual is, the opposite of asexual, someone who is interested in having sex with other people. We'll get into more of that later. What about the prevalence? And again, we'll go into some micro on the prevalence, but just in general, so everyone understands that about 1% of people in Western countries identify as asexual or have been found to be asexual. That's about 3 million people in the United States and perhaps 75 million people around the globe. So again, about 1%. So it's not a lot of people, but it certainly isn't, minuscule. 1%, 3 million people in the United States. That's a lot of people. All right, so let's go into asexuality in history. There's been a lot of speculation online and among authors about asexual figures in history. For example, people speculate that Isaac Newton was asexual. If Isaac Newton were alive today and knew about asexuality, according to these people, he would identify as asexual. He supposedly died a virgin, so, who knows. Jane Austen, the writer, the English novelist who wrote during the late 1700s, early 1800s, again, people look at her life and think that she was asexual. She apparently never got married, and she wrote a lot of romance books that didn't have any sexual things in it. But, a lot of people don't like to write about sex, so it doesn't mean she's asexual. But, speculate about that. Emily Bronte, similar 1800s English writer, people speculate she was asexual. Chopin, Adolf Hitler, people speculate that Hitler was asexual. H.P. Lovecraft, Florence Nightingale, Nikola Tesla, all these people have been identified as asexual people. What I will say is there's no way to know because we would have to talk to them. And asexuality is more complex than simply looking at someone and saying that they don't have sex. Just because someone doesn't have sex doesn't mean that they're asexual. We'll get into more of that later. Fictional asexual people that the internet talks about are Sherlock Holmes and Sheldon on Big Bang Theory. I would put forth maybe Yoda was asexual. Varys from Game of Thrones, the spider. The Doctor of Doctor Who, the Professor on Gilligan's Island, because he didn't seem to really want Marianne or what was the other woman's name? Anyway, Bilbo Baggins, people say he was asexual. Dumbledore. But to me, this is really silly. I mean, in the Lord of the Rings books, for example, I can't recall anyone having sex with anybody. I mean, I suppose you could say maybe it was implied that Arwen and Aragorn had sex, but I don't even think they talk about it much. So I think that looking in fiction for asexuality, unless it's really explicit, like Sheldon, for example, on Big Bang Theory, one could maybe argue that he would be identified as asexual. But again, you'd have to talk to his character because he might actually... I've seen a couple episodes of Big Bang Theory, and I've seen some of the scenes where they have that as a topic, where Sheldon and his girlfriend wants to have sex with him, and he's like, okay, on your birthday, we have sex. So the rest of the year, we don't have sex. And so is it that he doesn't like to have sex, or is it that he just has a lot of trouble with having sex, or his compulsions get in the way of him enjoying sex? There's just a lot of things in there that we should get into. And like I said, there's no definitive answer to these things. But I just want everyone to be a little cautious when we throw out diagnoses, so to speak, of it's not a diagnosis, it's a identity label or a reality that people live, shall I say, similar to being gay or trans. It's like, I don't just identify as being gay. This is my reality. I'm attracted to people of the same gender. So we should be careful of just throwing around the term asexuality. It's like, looking at Sherlock Holmes and saying, oh, he was a gay character. And Sherlock Holmes and Watson were gay for each other. And I've seen people speculate about that. In fact, there's a whole internet community centered around that idea. And, it's fun, but we just have to make sure that we're not demeaning or looking too simplistically at these sorts of things. People who live as people who are asexual are real people who have complex lives, and you can't just look at them and their lifestyle, and especially in fiction or in history, and just be like, oh, you're asexual. It's more complicated than that. Okay, so let's go into some history of the actual concept of asexuality. So the term asexual has been used in biology for a long time. In biology, the word asexual usually describes organisms that do not use sex to reproduce. So animals that just, like bacteria who just sort of, I don't know, I'm not a biologist, but a bacteria cell doesn't have sex with another bacteria cell. The bacteria cell just splits into two, right? Maybe some bacteria have sex. I don't know. Anyway, in fact, asexuality was the predominant way in which organisms reproduced in the past. And there are some animals like bacteria who still use asexuality as the way of reproducing. Strawberries apparently are asexual at least part of the time, if not all the time. Some worms are asexual, and apparently sharks can reproduce asexually. And even some animals that we consider to be sexual, allosexual, some of the members of that group will be found to look as though they're asexual. So one study, Roselli et al. In 2014, looked at rams and found that these rams, 13% of them appeared to be asexual. Now, again, this is not human asexuality, or it could be, but it's hard to know because you can't go to the ram and ask them why they're not having sex. Maybe it's, because of some other reason. Maybe they really want to have sex, but they are refraining for some other reason. So we can't really say that the rams are, quote unquote, asexual in the way that we use it with humans. But there are studies looking at animals, and the idea goes is that among a population of a species, there are, in mammals, you'll find that there's heterosexual members of the species. There often is a percentage of homosexual people or members of the species. And what they're all saying is like, hey, there's also another percentage among some species of seemingly asexual, that they don't have sex with anybody. And you'll also find different spectrums regarding how interested certain members are in sex and how disinterested. So there's just a lot of variation, even when you look at other animals, regarding sexuality and what they are attracted to and how intensely their attraction is. When it comes to humans, Kinsey et al. In 1948-1953 studied a lot of things regarding sex, including people who weren't interested in having sex. Kinsey et al., famous sex researcher in the 40s and 50s, found that when they interviewed people, that they were like, oh, there's because they interviewed heterosexuals and they're like, hey, there's a good percentage of people who are closeted homosexuals, and oh, hey, there's this other group of people who actually seem to not be attracted to anybody. They don't want to have sex with someone of the opposite gender, and they don't want to have sex with someone of the same gender. They're just not interested in sex at all. Johnson, another famous sex researcher, 1977, coined the term asexual, referring to people who lack sexual desire. So now we're getting more into not just behavior, but what's going on the inside, which is a key to understanding asexuality. Just not having sex doesn't make you asexual. The key to understanding the current conceptualization of asexuality for the identity of sexuality is to understand that It's an internal experience for the person that they lack sexual desire. Because the thing is that someone who identifies as asexual might actually engage in sex with other people for various reasons. Maybe they're married and they want to please their spouse. Maybe they just they're bored, they want to pass the time. There's a lot of reasons why an asexual person might have sex when they don't actually have any attraction sexually to other people. You could say the same for gay people, right? If you had a gay man and he was only attracted to men and not attracted to women, but let's say he didn't know he was gay, or, it hadn't come out yet when he was younger, and he gets married and has kids, and his wife wants to have sex. He is not attracted to her sexually, but he has sex with her sometimes because he knows that it'll keep their relationship strong, and maybe even he does it for procreation reasons, who knows. But the point is that just because he is married to a woman and he is having sex with a woman on a semi-regular basis, that does not take away the fact that he is gay, right? Now, we'd have to ask him and say, do you identify as gay? What's your internal experience like? Are you attracted to women? Blah, blah, blah. And so this is a key understanding to understanding asexuality. Storms, another researcher, author, 1979, 1980, 1981, was the first to depict asexuality as a sexual orientation. So in the late 70s, early 80s, Storms introduced the notion of looking at asexuality as a sexual orientation, not just something that we observe in other people. Okay, so let's go into detail about what asexuality is. I've talked about it a little bit so far, but let's really comb through the details so that everyone can understand the full breadth of the concept. So again, as I said before, an asexual person does not experience sexual attraction. They don't experience that in themselves. In the same way that a 100% heterosexual person may not experience sexual attraction to people of the same gender, or a lesbian, 100% lesbian, may not experience any sexual attraction to male gendered people. So that's the idea, is that asexual people they don't experience sexual attraction for anybody. And we can all relate to that, right? We can all, or at least most of us, can relate to the fact that there are some people we're not sexually attracted to. And you couldn't pay us enough to have sex with those people, right? Well, for asexual people, everyone is on that list. You could, you probably, some asexual people will have sex with other people, but I hope you get my meaning. Anyway, some asexual people are just simply uninterested in sex. They're just like, nah, not really my thing. If I had a choice, I wouldn't have sex for the rest of my life. But there are other asexual people who are actually fully repulsed by the idea of sex. It's actually something that's quite disgusting to them to think about. So you have uninterested, the meh type of asexual people towards sexuality, and you have the people who are repulsed by it. And again, as I said earlier, this is not to be confused with celibacy or just refraining from having sex. It's not abstaining like a priest. It's actual dislike of having sex with anybody. Also, as I said earlier, some say it's a sexual orientation. I use it as a sexual orientation, like heterosexuality or homosexuality or bisexuality. And many people in the world identify as being asexual, as in, I am a cisgender asexual male. Now, the other thing here to point out is that people who are asexual, who identify as such and don't experience any sexual attraction to anybody, they might or might not experience other forms of attraction. So there are other asexual people have helped us to understand that there are different types of attraction when it comes to other human beings. And as a society, I think we tend to just blanketly call those all sexual attraction because we're so repressed sexually that we can't help but to look at everything through that lens. But there are other kinds of attraction, right, that an asexual person might or might not experience that really have nothing to do with sex. Like there's romantic attraction, like having a partner or a companion, right? So an asexual person might have a ton of romantic attraction to other people. They want to date them. They want to look at them. They want to hang out with them. They want to, lay around in bed with them. And they don't want them to spend any time with other people. This is romantic attraction, but at the same time, an asexual person would say, yeah, but I don't want to have sex with that person. I'm very romantically attracted, but I don't want to have sex with that person. So that's an important thing. There's actually something called aromanticism, or being aromantic, which is also the absence of experiencing any romantic attraction to anybody else. So this is interesting, right? Because I think in other circles, people might think that romantic attraction is just a nice way of saying sexual attraction. But we see in the world, there are people who lack sexual attraction for other people, but have romantic attraction. So they must be different experiences, right? There's also what they call aesthetic attraction. So asexual people may or may not have this as well, in which they are attracted to the way that people look, but they still don't want to have sex with them, right? So they might say like, yeah, I think that dude's attractive, but I don't want to have sex with that guy. And here's a couple quotes from some articles that I read from people who identify as asexual. Quote, "Being asexual, you're not attracted sexually. I can appreciate my partner's aesthetics, but it's roughly the same when I look at a marble statue in a museum." So that's a weird sentence. But anyway, so this person's saying, I like the way my partner looks, but that doesn't mean I want to have sex with them. And it's the same as when I look at a marble statue in a museum. I don't want to have sex with that statue, but I like the way the muscles look or the boobs look or whatever, Another quote from another article, "I don't like chocolate cake. I can see a slice and think that it looks good, but I know if I bite into it, I'm not going to enjoy it." End quote. So, and I think most of us can relate to that, right? I'm actually that way. When I look at cake, I just think, man, does that look good? But through my experience in my later years, I know that if I eat cake, I will feel like crap afterwards. There's just, it'll be sort of good going down, but instantly, as soon as it hits my stomach, there's something about cake that just, I think it's sugar in general. Chocolate is starting to get bad for me. So yeah, I can appreciate, but at the same time, I'm deeply attracted to cake and chocolate. So I can't really relate on that level completely. But anyway, so again, you can have sexual attraction or no sexual attraction to others. You can have romantic attraction or no romantic attraction to others. You can have aesthetic attraction or no aesthetic attraction. And then the fourth one here is sensual attraction or sensual interest. So this is the label that they use for being attracted to people because you want to cuddle with them or you want to hug them or you might want to kiss them. But again, you don't want to have sex. Here's another quote from another article. So this is a person talking about them and their partner. "We hug, we kiss on the cheek. There's a lot of verbal intimacy rather than physical intimacy. But we don't do anything sexual. We have no plans to do so or desire it." End quote. So here we have someone who likes to hug, they like to kiss on the cheek, but they don't want to have sex. And again, I think in our society, we tend to lump all these things into a sexual thing. It's actually, it might be particularly American, because I see in other cultures around the world more of this sensual touching, or I don't know what you would call it, but just touching other people in ways like hugging or kissing or holding hands, and it not being immediately identified as a sexual act. Whereas in American society, we look at those things and instantly think, ooh, that's a sexual act. And no, of course not. That's silly. So with asexual people, they might actually enjoy kissing and hugging. That's good. Huggling and cuddling. And that's important to point out. But some of them might not. Some people are asexual. They're aromantic. They don't appreciate the aesthetics in other people, and they're not interested in any sensual touch. So there's just a wide variety of people who are asexual. Okay, what about sexual arousal? Do asexual people get boners? Do they get wet, so to speak? And the answer is yes, they may or may not have that. But again, when they get boners and when they get wet and engorged, or whatever we want to say, they still don't want to have sex with other people. Here's another quote from a participant in a study. I did, test the equipment, and everything works fine, pleasurable and all. It's just not actually attracted to anything. So this person's saying, look, I tested out my genitals. I can make it work. It works fine, but it's great, feels good, but I don't have any desire to share it with someone else. Also, asexual people might have orgasms. Some don't, but some do. Many do. In fact, I would say most do. Brado and colleagues' study in 2010, they found that there was no difference in orgasm between asexual people and allosexual people. So that's important to point out, because I think one myth that people might jump to is like, well, these people who are calling themselves asexual, I bet you they're just people who can't have orgasms, and therefore they hate sex because they can't have any orgasms. Well, here we see that research has found that asexual people can and maybe often do have orgasms, and they still have no sexual attraction to other humans. Brado and Ewell in 2011 found that asexual women had less trouble reaching orgasm, that they reached orgasms more often during sex and were more satisfied with their ability to reach orgasm. Now, it should be pointed out that these studies had small sample sizes, but I just want to point this out. If this is, the fact is asexuality research is pretty much in its infancy. So we'll find out more information later. But I just want to point out that this one study found that asexual women had orgasms quicker than allosexual women, and that they were more satisfied with their ability to reach orgasms. So it's interesting to point out. I could speculate as to why. Maybe it's because asexual women have orgasms less often, and therefore are sort of bursting. their dam is bursting, and when all you got to do is sort of touch the dam and it bursts. That's a terrible analogy, but it's one speculation. Of course, there are many asexual people who orgasm regularly through masturbation or through sex, because again, a lot of asexual people engage in sex for various reasons. So along those lines, asexual people masturbate at similar rates to allosexual people, and they might even fantasize about other people sexually. But again, they don't want to actually engage in that fantasy and actually have sex with other people. Research has found that a significant amount of asexual people engage in masturbation. One study, Brado and colleagues, 2010, found that about 80% of asexual men and women engage in masturbation. So it's pretty high. 80% of asexual people masturbate, according to this one study. But other studies, like Bogert 2013, found that on average, asexual people masturbate to a less frequent degree. And Brado and Ewell in 2011 found no difference in frequency of masturbation in asexual women compared to allosexual women. So there's been some research, and in preliminary findings indicate that when it comes to masturbation, asexual people are the same as allosexual people. Maybe they masturbate a little less often, but they still masturbate. Now, they will often report that they fantasize about different things, or their experience of fantasy is different. Like they tend to, on average, indicate that they fantasize not about particular people. Like they don't target actual people in their lives, or maybe even actual people. And I'll get more into that later. But again, there are some asexual people who don't masturbate at all, and it's a part of their asexuality. They don't experience any arousal ever. They don't like to fantasize. They don't like to masturbate. These people, this group of asexuals, have been coined the non-libidoist asexuals. So they lack a libido, so they're non-libidoist. Asexual people have the same attachment needs as anybody else. We all generally need attachment. The vast majority of us, I would argue, even the psychopaths need attachment. There's very few people who lack the need for any attachment. Some people have a lesser need, avoidant people, schizoid people. But I've found that even those people have attachment needs. They're just different. But anyway, asexuals have the same attachment needs that anybody else would. So they might fulfill those attachment needs through family or friends or even romantic relationships that are not sexual, if for their hope anyway. Some asexuals are asexual for life, meaning that they realize they're asexual when they're, 12, and they live their entire life knowing that they're asexual and try to never have sex with anyone for their entire life. This is similar to people who have other sexual orientations, right? But also some people might actually phase in and out of different sexualities. Again, similar to other sexual orientations. Someone might identify as heterosexual, and then they later in life, 35 years old, they're like, hey, I think I'm lesbian, actually. I appreciated my heterosexual years, but I think I've changed, and now I'm lesbian. And they identify as a lesbian for 20 years. And maybe after that, they enter a phase of asexuality where they're not attracted to anybody. So asexuality can be both. It can be both something that someone identifies with or even has the experiences of for a period of time that isn't their entire life, and other people will say it's their entire life. But in general, people who are asexual, particularly by the time they're 25, 30 years old, if they're still identifying that way, it tends to stick, or at least in my anecdotal experience. Okay, so let's continue this talk, but let's take a break first. What do you say? Okay, we're back from the break. If you like this podcast and the various different things we talk about, I would invite you to become a patron of the podcast by going to patreon.com. In this podcast of almost 800 episodes, we talk about a lot of things, but one of the things that I have spent a lot of time and effort on is advocating for a greater understanding of sexual orientations in general, and for sex positivity, for less shaming, less Victorian attitudes, more compassion, more self-compassion. And so if you are in agreement with those political views, I invite you to become a patron, because the more funds we have for the podcast, the more time and effort I can put into advocacy in this way. And the different charities that we've given to, for example, we gave a lot of money from patron money. We gave it to the Trevor Project, which helps to save the lives, literally, of LGBTQ youth who might be contemplating suicide, and so it helps them to get through those difficult years. So if you support that political view, I encourage you to become a patron. I think as I move forward, I will start to identify certain political stances that I want to be a part of, and this is definitely one of them. I identify as a cisgender heterosexual male, and so it's not for me personally, but when I see people in the world being treated unfairly, it hurts my feelings and makes me extremely rageful. I don't know what that is, but ever since I was young, I have known that I have an abnormal sense of justice and a high reactivity to it. If you listen to this podcast, you've seen it a little bit, but honestly, you've never seen me as rageful as I actually can be when it comes to certain political things. And for example, for asexuals, the way that society treats them is so inherently illogical and upsetting to me, and I have to do something about it. It's so bothersome that innocent people who are just saying, hey, they're just raising their hand and they're just be like, hey, you know what? I don't know why, but I am not into sex and I don't want to have sex and I have no sexual attraction for other people. For society to treat that person badly, even in a small way, is so stupid and unnecessary and wrong and immoral and anti-American. And if you're a Christian, it's anti-Christian. And it's just so awful. And I want to try to change that in my small, tiny little way. And so if you are on board with me, again, I invite you to be a patron of the podcast. That's how I get the literal time and effort to be able to advocate for such things. This episode, incidentally, I thought I could prep for it in a day. And I actually plan on talking with Umberto about this. But in the time that I had to prep for podcasting with him before he came over, I figured out, oh my God, this topic is so much bigger than I realized. And so I dedicated a couple weeks of my free time to this. So, it's probably been about 50 to 60 hours of researching and talking to people about this to prep for this. So again, please become a patron. All right. So many asexual people might have sex regardless of not being into having sex. Research has found that about 35% of asexual people have had sex at some point in their lives, which actually isn't that much when you think about it, right? Because in my mind, when I thought about asexual people, I thought, well, asexual people they must have a really hard time in this world because they have to fit into a allosexual world. And they probably just, due to necessity, have probably had to give in and have sex with people even though they're not really into it. But according to this, and I would have thought, percentage-wise, I would have been like, I don't know, 80, 90% of asexuals have had sex at some point in their life, at least once anyway, just to even see if they like it. But there's been some research that said that only 35% of asexual people have had sex at least once in their lives. So, but other research have found higher numbers than that. But anyway, the point is that, again, we don't really know the full details. But some asexual people will have sex with other people. Some of them, I'm guessing, because they're being pressured unfairly by spouses or partners. But others, like I said before, they might just do it because they're like, look, I'm asexual, and my wife is allosexual, and I want her to be happy, and so I'm going to have sex with her. And, I'm not into it, but I'm not averse to it. So, it's fine. I'll do it. And when researchers have looked at why asexual people typically have sex, and it's just for that reason, it's to please their romantic partners. This is actually a really common experience. Having said that, there are plenty of asexual people who have an agreement with their spouse that they don't have sex, or they are in relationships with other asexual people, which is probably the perfect situation, right? If you're a romantic, if you're into romance and you're into sensual touch and you're into aesthetic attraction, but you're not into sexual attraction, then having another asexual partner who also is interested in hugging and kissing and cuddling and Also interested in romance is the perfect situation. Similar to the way if you're gay, having a gay partner is probably best for you, right? So that kind of thing. It's all about compatibility, folks. Asexual people may vary regarding their sex positivity. Kerrigan, 2011, found this to be true, which I found to be an interesting way of looking at this, is that some asexual, so one of the myths that I think might be out there is that, oh, asexual people, they're probably just a bunch of stick in the mud people who hate sex. You know, they're real prissy and uptight and this kind of thing. And of course, that's silly, but one researcher actually found this to be silly. And they found that there's a spectrum. So you have some people who are very sex positive, meaning that they're totally cool with people having sex. They're totally cool with the idea of other people having sex. They're totally cool with maybe even seeing other people have sex, but they're just not interested in having sex themselves. They have no sexual attraction. They have no desire to have sex with other people themselves. They might even watch pornography and watching other people having sex while they masturbate, this kind of thing, maybe. Anyway, but so some people are very sex positive. Some other people might be a little agnostic about sex. They're not sex positive per se, and they're just sort of like, I'm not really into sex and I'd rather not have it in my life. I get that people like to have sex in the world, but it's just not really for me. And here's one quote from an article that I found from an asexual person along these lines. They said, "It's really weird how much sex is in cinemas. And when there's kissing on TV, I have to close my eyes and look away." So when I read this article, it did actually kind of hit me about how much sexuality is a part of our culture and around the world, right? When you have Empire Strikes Back and you see Han and Leia having to navigate, their relationship. She's a princess and he's just a scruffy-faced nerf herder, a scruffy nerfer, and a scoundrel. And the whole tension around will they or won't they, it's just highly prevalent in movies and in TV shows and stories. Will they have sex? And we're supposed to be able to identify with these people. We're supposed to be able to say, oh, I can sense that tension. And if you can't identify with that at all, like you have no sexual attraction for other people, then it must be really weird to watch these TV shows and these movies and just be like, why, this stuff is just so crazy. Like, why are people sexually attracted to other people? It doesn't make any sense. I don't get it. I don't like it. It's not appealing to me. I wish I didn't have to see it so often. And so I think it's my category is I'm just calling them agnostic sex people. And then there are some asexual people who are actually anti-sex. To them, the idea of having sex is really problematic. They really think that sex is like gross or politically problematic or disgusting or deeply troubling to them. You're just like, they might say, I cannot understand why you would want one of those inside of you, that kind of stuff. So they don't have a lot of sex positivity in that way. They might, again, be kind of cool with the idea that other people are having sex, but it's really, really repulsive to them. So again, there's a wide variety of asexual people with a wide variety of attitudes towards sex in the world. Okay, and the last thing I'll say about asexuality is that having understood, or if you understand everything I've said so far, there's a wide variety of people who identify as asexual. The key component of asexuality is that they don't experience sexual attraction to other people, which means that they're not likely to have sex with other people, but they might actually have sex with other people for various different reasons. They might masturbate, they might have sexual fantasies, they might not. They might have romantic attraction or sensual interest or aesthetic attraction to other people, they might not. It's not just celibacy. So if you understand all that in your mind, and make sure you understand that before I move forward, solidify all those ideas in your head. Because The last point I want to make about how to describe asexuality is that sometimes people who lack sexual drive, it's due to what we might identify as a reason that can be treated. Like, for example, someone who has been traumatized, specifically experiencing early sexual trauma, right? If you were sexually abused as a child, your emerging sexuality through your teen years and into early adulthood might become quite suppressed due to complications in the way that you experience sexuality. You might actually, upon being aroused sexually, you might actually be triggered to experience supreme distress due to your PTSD. And Sato, 2008, found this to be true. So it's important to know that the vast majority of people who identify as asexual, this is not the case. But you could imagine that for someone who has been sexually abused, that, they're 35 years old and they have PTSD about sexuality, and they might identify as being asexual. They just be like, look, they may or may not even know why, right? But let's say they do know why. Let's say they're like, yeah, I was sexually abused by my father when I was a child, and I experimented with having sex with other people in my early life and found that I hated it. And yeah, if I recovered from my trauma, I guess there's a possibility that my enjoyment of sex might emerge. But you know what? I don't care. I don't like sex, and that's fine with me. So there's so the converse to this that people will propose, which of course we have no way of demonstrating, is that some people are just born asexual. Is that, in the same way that some people are born gay or born lesbian or born trans or born hetero or born cis, there are people who say that it has nothing to do with the environment, right? It's just who you are. It's in your bones. And certainly I absolutely adhere to this point of view, but we just can't really know. Maybe every hetero person has to have an experience to sort of push them to heterosexuality. It's just impossible for us to demonstrate, and impossible given ethics for us to experiment on. If we really wanted to find this out, we would take hundreds of babies and raise them in different environment bubbles and see how much environment plays into sexual orientation. But anyway, so know that for some, trauma might be a factor in asexuality. But I caution you to think, oh, that person's asexual, therefore they've been sexually traumatized. That is probably not a good guess to make, because I would imagine a very small minority of people fit this narrative. Stress can also lead to a lack of sex drive. It's hard to imagine a 30-year-old asexual person having consistent high stress that will completely eliminate their sexual drive, that will lead them to believe they're asexual. Because here's the thing: if you're allosexual, this means that you probably have a pretty deep biological drive to have sex, at least some of the time. And a little bit of, or a lot of stress might get in the way some of the times, but it's not going to get in the way all the time, right? So, but we can imagine that ongoing stress, say you have a 25-year-old person, 23-year-old person who has been experiencing lots of grief, lots of stress, and they've just never been able to relax to the point where sex has been enjoyable to them, and they've had a lot of bad sexual experiences, and so they're just like, I'm just not really into sex. And once you reduce their stress and they're able to navigate relationships in a different way, maybe their deep-seated allosexuality will emerge. Hard to say, but something clinically to look at. An STI could cause someone to think about asexuality. People have a lot of shame about having sexually transmitted infections. People might even have pain as a result, or other kinds of limitations resulting from an STI that could be a factor involved in someone identifying as asexual. Again, there are plenty of people. In fact, I would say most people who identify as asexual, when you really look at them, these factors don't really play a role. It'd be like saying, an STI made me gay or something. It's like, no, people who are asexual are deeply asexual. They really are just like, you know what? I've known for years that there's just something different about me. I just am not attracted to other human beings. I get why people have sex, I guess, but it's just not my thing. And an STI isn't going to make me this way. This is pretty deeply in my personality. So I just want to remind that. But again, looking at some other factors that can lead to someone considering asexuality, or because the thing is I get a lot of emails from people asking me, what I think about their asexuality. And they will often identify various different factors. And I'll get into the treatment in terms of how to help someone explore their sexuality at the end here. But for some people, when they're first beginning to explore this, there's a big question mark in their mind that they wonder, am I asexual truly? Or do I have factors that are affecting me and suppressing my allosexuality? And so for a lot of people, that's a question. And for some of them, they will emerge after exploration that, the medication I was taking or the stress I was under or the trauma that I hadn't recovered from, that was suppressing my allosexuality. And now that I've overcome those issues, I now have, a rich sexual attraction to other people. But for others, they will do all those things and they'll find that, nope, I still have no attraction to other human beings. And so for a lot of people, it's an exploration thing. And so I'm just going over those other factors that might be involved in suppressing allosexuality. And that's my phrase. I don't know if I like it, suppressing allosexuality, that I just made up. So other issues that might suppress allosexuality is the thinning of genital tissues or vaginal dryness or pain during sex, right? However, one study, Brado and colleagues, 2010, found that there's not any difference in the scores on sexual pain between asexual women and sexual women, allosexual women. However, on the other hand, Brado and Ewell in 2011 found that for asexual women, there was a slight increased score on pain scores. So in other words, some studies indicate that there are, among asexual people, they don't experience pain any more than allosexual people. So pain doesn't seem to be a major reason, because again, that could be a myth that could be thrown around, right? It's like, well, the only reason why you're asexual is because you must be experiencing some kind of pain. And once we address that pain, then you'll like sex again. And some studies show that there's not as much, that asexual people experience the same amount of pain during sex as allosexual people. However, another study found that there's a slight increase in the rate of pain among asexual women during sex, but probably not much of a thing there. But you could imagine that, say, you had some functional biological problem with regards to your genitals that could result in being asexual, right? Even though you have a deep desire to have sex with other people, the pain is so recurrent that it, through repetition, just eliminates any sexual drive you have towards other people. You can see that happening. Erectile dysfunction from various different issues could be, low blood pressure or some medication you're taking could cause someone to say, you know what, I guess I'm not really attracted to other people, even though they might actually have an allosexual urge. They're just like, well, I don't really get boners other people, and a lot of my sexual experiences with others tends to go badly, so maybe I just don't have enough attraction to other people. Because that's the other thing about when people are exploring whether or not they're allosexual or asexual, it's hard to know what is the normal amount of sexual attraction to other people, right? Or what's the normal range, right? Because it's not something you can actually see. It's only something you can describe inside of you. So that's another issue. Depression, anxiety can also definitely suppress someone's natural allosexuality. Medication in particular, there's a lot of medications for depression and anxiety that will completely eliminate your sexual libido. I've seen this many times clinically. It's a big problem, and it's a problem that a lot of physicians, psychiatrists don't pay enough attention to. You'll have someone that will be coming in with mild depression, and the psychiatrist is like, okay, well, there's this SSRI that will help eliminate those mild depressive symptoms. Your sleep will get a little better. You'll cry a little less often. You'll be a little bit more motivated. But what they don't say is, and by the way, taking this pill will completely eliminate your drive for sex. You will not want to have sex with your spouse ever again for the rest of your life on this pill. Sex with your spouse will be completely abhorrent to you, which some of these meds can absolutely do. They don't always do it. Also, the birth control pill can do this to a lot of women as well. There's a lot of things that can interfere with someone's sexual drive and their attraction to other people. So that's another thing to look at, right? So a woman comes in and says, for the past 20 years, I have not wanted to have sex with anybody. And, I've obliged my husband every now and then, maybe once every couple of years. But man, it's just not really something I want to be doing. And at first blush, you might be thinking, oh, okay, well, clearly this person is asexual, right? Well, there's a lot of other possibilities. Medication, the relationship problems. There's just a lot of different things that can contribute to that. Having said that, and I'll get into more of this later, I guess I'm getting into it now as I'm talking about it, we need to also very much embrace the full possibility that the person actually is asexual. We don't want to look at everyone who lacks sexual drive as necessarily someone who has a suppressed allosexuality. We just want to be open to all things. In fact, we probably should be a little more open to the possibility of asexuality because society will definitely push them in the other direction anyway, so we might want to counteract that a little bit. Anyway, obviously, relationship conflict and attachment insecurity can affect someone's allosexuality. Also, never having a responsive sexual partner can absolutely cause someone to think that sex is always, terrible. Also, there are some people who have phobias of it's very specific things we call specific phobias of genitals or of having sex or of if you're a heterosexual woman having something inside of you you could be phobic about that. Just like any other phobia. Sometimes people associate phobias with fear, like fear of snakes or something. And certainly that's one way of looking at phobias. But another way of looking at phobias is just aversion to. So some people have phobias for things with holes. Like if you've ever seen a lotus root or the back of a frog. I hope I'm not triggering anybody. Or bubbles coming out of mud, a bunch of bubbles coming out of mud. I can't remember the exact phobia, but it's a phobia that something like 5-10% of people have to varying degree, and some people have it a lot. And so you wouldn't say that the person is afraid of seeing holes in things. They just have an extreme aversion to it. Similar to like, for me, for example, when I hear styrofoam rubbing against each other or someone rubbing on a balloon, that sound drives me crazy. I'm not afraid of it. I'm just very averse to that sound. It makes my teeth hurt. And so for some people, they have, it is a very rare condition, but this could lead to asexuality. They have a phobia or an extreme aversion to genitals. And they're just completely disgusted. They can't stand looking at it. They can't stand thinking about it. It's like, scratching on a chalkboard to them just to think about people's genitals or think about sex in general, that kind of stuff. So again, those are the things that I found in the research and things that I've found clinically that can, and there's many more possibilities, but those are the main ones. Things that what I guess I'm framing as things that can interfere with allosexuality. So you're an allosexual person, you have a normal you have a normal for an allosexual person, you have a normal amount of sexual attraction to other people, and one or more things are getting in the way of your natural sexual attraction to other people, and you experience life as an asexual person. Now, people like this, there's nothing wrong with them saying, you know what, I'm asexual and I don't care. I guess it's possible that I have an allosexual person on the inside of me that as being suppressed by trauma or depression or attachment insecurity or phobia of genitals or whatever. And I don't care. I don't care enough to change it. It's not a big deal to me. I don't miss what I don't care about. And so I'm just going to continue being an asexual person, even though I guess it's possible that I wasn't born this way, so to speak. That is totally fine. People are free to do what they want. It is not a big deal for someone to say, I don't like sex. People can like sex, you can not like sex. There's something very threatening to a paternal society when people do this, when they don't fit into our heteronormative cisgender world, and it's very upsetting politically. If you went on Fox News and said you were asexual, I'm guessing that wouldn't go over very well. There's just something upsetting to not being quote unquote normal or traditional in our society. And so there's nothing wrong with saying I'm asexual. There's absolutely nothing wrong with it, regardless of where it comes from. It's just what you want to do with your life and how you are potentially. But I do want to point out that there's a lot of debate, and of course, as I said, no way to know that some people are born asexual in the way that some people are born allosexual. And there are potentially another group of people who are born allosexual, but they have something happen to them where they feel as though they're quote unquote asexual. Now, those people, as I said, are completely free politically, morally, ethically to continue to identify as asexual. And it doesn't mean they're any less asexual than the quote unquote people who were born asexual, which of course we have no way of knowing. So there's no such thing as a real asexual and a interloper asexual. There's just asexual people. The same could be said, I guess, in the reverse, right? Say you're born asexual and you take a medication and suddenly you have all this sexual attraction to other people. And you're like, oh, I guess I'm allosexual now. Well, would we say to that person, no, you're not a real allosexual. You're actually an asexual person who is taking a medication to make you allosexual. We wouldn't say that. At least I hope we wouldn't say that. If that person wants to say, you know what, I'm allosexual now only because I take this medication. And isn't that weird? Of course, this doesn't exist, but just in a hypothetical world. And we wouldn't say like, hey, stop it. You can't identify as allosexual. That's politically wrong. You're an interloper. It's like, come on. Let's take it easy on individuals. Let's let them identify however they want to and value that and know that there are many roads to many lives. Let's just put it that way. Okay. And for you asexual people out there, let me know what you think as I'm talking about this, because I'm curious. All right, I am on page 5 of my 18 pages of notes. So this is going to be another long one. All right, so typical stages of coming out, so to speak, or of individual discovery of asexuality are the following. This is based on things that I've read and also clinical experience. So people who are asexual, sometimes they start off early in life, typically in their teenage years, not knowing about asexuality as a thing. They don't know the term, they don't know the identity, they don't know the internet area or the community. They don't know anything about asexuality. And yet they have no sexual desire for other people. But they believe, given pressures from society and family and maybe internal pressures, that they need to give sex a try. And and they give sex a try and it doesn't go very well. Maybe they try it a couple more times, it doesn't go very well. And they instantly think that there's something wrong with them. But at the same time, they're like, well, sex is not very enjoyable for me, so I'm going to avoid it. Then friends, family, society starts to notice there's something different about this person, and they become marginalized by the people around them. People might not want to hang out with them as much. They might stigmatize them. Maybe, oh, you're such a Sheldon from Big Bang Theory or something. There can be a lot of hurtful things that people will say when they don't understand something. And then the asexual person feels bad about themselves and they try to make sense of it all. They try to maybe experiment with different identities. Maybe I'm gay, maybe I'm trans, and maybe they are gay, maybe they are trans. But the point is they start trying to figure it out, right? And at some point, hopefully they look on the internet and hopefully they find the asexual community. And in my experience, when this happens, asexual people instantly know that they're asexual. They will read just a couple sentences of the asexuality thing, and they'll just be like, "Oh my God, that's me! Oh my God, that's me! I didn't know that was a thing. I thought I was the only one on the planet who was like this. I thought the entire world was a sexual world, and now I'm realizing that there are millions of other people who are like me, who don't experience any sexual attraction for other people, and they feel liberated. And they start to begin to live a life that they deserve, where they start to say to themselves, I'm okay with being asexual. And hey, there are other asexual people in the world, and there are ways that I can advocate for myself, and there are different kinds of relationships that maybe don't involve any sex. But these people obviously still experience a lot of societal marginalization and maybe pressure from family and friends to get into a sexual relationship and have children. A very common family statement will be like, when are you going to get married? When are you going to have kids? It's just a refrain that people have, which is well-meaning, I suppose, but completely disregards not only asexual people, but people who aren't interested in having children, or people who are in polyamorous relationships maybe. There's just a lot of different lives that are moral and desired by people, and this compulsion to everyone must get married, they must have children. It's one of the most common happy endings to a movie and the couple got married and they had 5 children. It's just this. It's fine to do that, obviously, if that's your life. It's a wonderful life to do that. And for many, it's the perfect life, but it's not the perfect life for everybody. And as we've been talking about in this episode, some people don't want to have sex with other people. So the notion of riding off into the sunset with your sexual partner is not enjoyable for them. And so the point is that even though the typical stages involve people eventually finding the asexual community, becoming liberated, having more self-esteem around it, accepting themselves around this, that doesn't mean that the journey is over. They still have to navigate society. Okay, so let's go into some definitions here. There are some terms that I want to talk about. Again, asexuality, someone who is asexual, is someone who does not experience sexual attraction and does not want to have sex. So again, it's not just someone who doesn't have sex. It's an internal. You can't look at someone and from their behavior know they're asexual. You have to ask them, are you sexually attracted to other people? And if they're like no, and then you say, do you want to have sex with other people? And they're like no, then you say, here's the definition of asexuality. Do you identify as asexual? And they'd be like, actually, yes. And so that's another point I want to give out, put forth is in the literature anyway, is there are two different ways of looking at asexuality. One is that it's a label that we put on other people, that we ask them, are you attracted to other people? Do you want to have sex with other people? How much sex have you had with other people? Have you ever wanted to have sex with other people? And then a expert identifies that person as being asexual. So top down. It's like, well, you're asexual. The other way of looking at asexuality is that it's something that you can only identify as. So in the same way that I can't look at someone, ask them a bunch of questions and say, you are gay. And they're like, no, I'm not. And you can't argue with them. You can't be like, yeah, you are, or trans or something. You can't just say, based on my assessment, you are a trans person. You can't do that politically, or it doesn't make any sense. And why would you want to? So the other way of looking at it is that you have to ask people. So you put forth the definition, the common definition of asexuality, and you say, so do you identify as asexual? Then you know whether or not someone's asexual or not. They might not even use the same definition. To me, this second one makes the most sense to me, and I believe this will be the common understanding of it moving forward. Another term here is demisexual. This is someone who is only attracted to people after forming a strong bond with them. So when I read this in the literature, I was like, well, isn't that everybody? Isn't that most people? Aren't most people mostly attracted to people that they are involved with emotionally? But I think what they mean by demisexual is someone who has zero sexual attraction to someone at first, and only after bonding with that person for however much time it takes, then they may or may not have sexual attraction to that person. So this is what they call demisexual. So there's that term. But again, in the literature, it's pretty gray in terms of what exactly constitutes a demisexual. But just know that there's a term like that. Also, there is terms called gray sexual or gray asexual. This is someone who identifies with the area between asexuality and allosexuality. They might experience sexual attraction in super rare situations, or they might sort of like sex, but they know that their libido is much less than other people. And so they say, well, I'm not entirely asexual. And so the terminology that has emerged is they call themselves gray sexual because they're in that gray zone. And as I've been talking about, allosexual is someone who experiences sexual attraction and does want to have sex with other people. Sometimes in literature, they just refer to these people as sexual, but it's a little problematic to say, you have sexual people and you have asexual people, because it's hard to know exactly what we're talking about. And so the term allosexual, I think, is more specific. It's similar to the way when we have trans people or non-binary gender people, we have that term. And then you're like, well, what do you call people who identify with the gender they were born with? And we call that cisgender, right? So it's good to have very specific terms for these kinds of things. Plus, it doesn't propose a normalcy and then an abnormal, right? So when we use sexual and asexual, it sort of implies that sexual is the normal and asexual is the abnormal. Whereas if you have allosexual and asexual, then it's like both of these terms are referring to, we're just calling two different groups, two different names. Okay. Another term used in the asexual community is ace, A-C-E, like, ace of clubs. This is an informal label used for asexuals and all the various different kinds. So you have demisexuals and gray sexuals and asexuals who masturbate and asexuals who don't, and asexuals who hate sex and asexuals who are, they're okay with other people having sex. So they call this the ace people or ace community. There's also aromanticism, as I've been talking about, people who are aromantic. This is someone who doesn't want to have a romantic relationship with other people. Now, aromantic people may be asexual and they may not be, but there is some correlation. So if you're asexual, you're more likely also to be aromantic. Bogart in 2004 found among a group of asexual people that 67% of the asexual people were not in long-term relationships at the time. So that's interesting, right? Among the general population, I don't know what the percentage is, but I'm guessing it's a lower percentage. Now, this could be for a lot of different reasons in terms of why aromanticism is associated with asexuality. I would think that there's a number of different possibilities. Like, say you're born asexual and you just have no sexual attraction for other people. Well, romance kind of does involve some sexuality. It's a factor, right? When you have lust for someone, it increases your potential for romantic feelings, I think, anyway, in terms of what people experience and tell me about. And so perhaps when you lack a sexual attraction to other people, it makes romantic gestures or romantic interest a little bit less likely. And maybe the reverse. Let's say you have no romantic interest in other people, but you're capable of having sexual attraction to other people, but you're just kind of like, I'm not really interested in bonding with other people romantically. So what's the point in having sex with other people? I'll just avoid the whole thing. And then there's another term here called autocorosexual. Autocorosexual. It's a subset of asexuality that's discussed in the literature. It was coined by Anthony Bogart, who was a major researcher in asexuality going back to the early 2000s. And autocorosexual is derived from autochorus, which is identityless sexuality. So it's sexuality that doesn't involve an identity. People in this subset of asexual people, they like to fantasize about others and masturbate, but they are neutral or repulsed by the idea of having sex with other people. The thing that I like to say is like, okay, imagine for yourself, let's say you're an allosexual person. Think about all the different sexual fantasies you've engaged in your life. Well, if you're like most people, some of your fantasies you do not have an interest in actually carrying through in the real world. Not because you worry about social stigma, but because you just know that if you really did it, you would not actually like it. You'd just be like, no, that just sounds awful if I was in real life. But in my head, man, does it get me going? Well, that's a similar analogy-wise thing to asexual people who fantasize about sex, but don't actually want to have sex with other people. So it's just another way of looking at it. Some asexuals masturbate for reasons other than sexual attraction, for example. This is an important thing. One participant in one study said that they masturbate to clean out the plumbing. They're just like, look, every once in a while you got to clean out the plumbing. So that's one reason why some asexuals will masturbate. Also, they might masturbate because they want to relax. So for some asexual people, when they masturbate, it might have nothing to do with even what we might term as anything close to allosexuality, right? It might just be like something like when you're rubbing your feet, for example, you're just doing it for relaxation, or you're getting a back massage, or you're giving yourself a back massage. You're just like, yeah, I like to do this. This makes me feel good. But you wouldn't say it's a sexual thing, right? You're just doing it to relax yourself. Research has found that asexuals who report having sexual fantasies, 11% of them reported that their fantasies did not depict any human persons, whereas only 0.5% of those in age-matched sexual comparison group. So, in other words, when they poll, so this is a study by Yule et al. 2014, when you ask allosexual people, okay, how many, when you engage in sexual fantasies, how many of you do not think about other human people? Your fantasies don't involve actual other humans. Only 0.5% of allosexual people says, oh, that's me. So very few allosexual people will say, when I fantasize, I don't fantasize about human beings. Whereas 11% of asexual people says, oh yeah, my fantasies don't depict other human people. What this also says is 89% of asexual people do fantasize about other people, but there's an increase in the rate of people fantasizing about just general things. Maybe they're fantasizing about themselves masturbating, by themselves or something, or they don't think about anything sexual at all. Maybe they're just like, they just think about something completely different, like a nice meadow or traveling into space or something. Anyway, some researchers assert that some autocorosexuals are only attracted to their own bodies. So this is actually kind of interesting. And I imagine that this would be a subset of asexual people who masturbate, but it's worth noting that they have a different way of or their sexuality has different targets. So there's two different types of people in this category. So you have some people who are their sexual target. So it's hard to explain, but for heterosexual people, if you just boil it down to a very simple statement, you would say their sexual target are people of the opposite gender, right? For gay and lesbian people, you would say in a very simple statement, their sexual target are people of the same gender, right? For bisexual people, their sexual target is people of either gender. Now, of course, they're not attracted to everyone, heterosexual and otherwise, but I hope you get what I'm saying. For some asexual people, their sexual target is not other people at all, but it's themselves. So when they masturbate, it's like they're having sex with someone, but it's themselves. Now, that's not to say that they're delusional and they believe that their genitals are on a different person's body, but they just have a tremendous amount of sexual attraction to themselves. And that's why they have no sexual attraction to other people. And it kind of makes sense, right? It's like, well, why not? If some people are attracted to other people, why can't some people be attracted to only themselves? Another form of autocorosexual person is when they're masturbating, they fantasize about sex that doesn't involve themselves at all. So a lot of people, when they masturbate and fantasize, they sort of insert themselves into a situation, right? So if you're a gay person, gay male, and you're watching gay porn, for example, you might insert yourself in either as a third person having sex with the couple, or maybe you one of the people that you're watching having sex, you're a stand-in for that person. You're imagining that you're the one doing that to the other person. Well, for some asexuals who masturbate, or people that some people in literature are calling autocorosexuals, they are attracted when they're experiencing sexual arousal and they're fantasizing or watching porn. They actually have no desire to themselves be in that scenario. They like watching sex, or they like fantasizing about other people having sex, but there's no personalization involved in that. So that's another interesting thing about our psychologies, right? You wouldn't, or at least I didn't before doing a deep dive on this, think about that sort of distinction, right? Now, having said that, that factor might result in a higher rate of asexuality, but you could actually be allosexual and have that as well, if that makes any sense. One person talked about this on a website. They said, quote, "I almost invariably think of fictional characters. My thoughts have never involved people I know, and they have never involved myself." So I'll just read this one again. When they're masturbating and fantasizing, I almost invariably think about fictional characters. My thoughts have never involved people I knew, and they have never involved myself. So it's just interesting to look at that. Okay. So now let's look at prevalence around the world. And I already talked about how about 1% of people identify as asexual, but let's look at this a little bit more finely. Kinsey et al., again, the famous Kinsey reports from the 40s and 50s about sexuality in the United States. They defined asexuality as behaviorally, meaning that it's just whether or not someone has sex or not, and they didn't identify it as something that had to do with internal desire. And they found that about 2% of men were asexual, regardless of whether or not they were married or not. And they found that among married women, about 2% of the married women did not have sex. But again, the Kinsey people, they didn't ask these women, well, do you want to have sex, or are you just not having sex even though you want to? But they also found that for unmarried women, about 17% of them were not having sex. So it's just a little detail there. So, but erase those figures from your mind, because it's just a behavioral observation, not a actual measure of asexuality as we're defining it today, which is the internal desire to have sex with other people and the internal sexual attraction to others. Okay, so let's look at prevalence around the world. There's not a lot of research on this, and the research that has been done is actually small in sample, so just take that with a grain of salt. I'm sure in 20 years we'll have a much more higher resolution understanding of this. Plus, it's hard to nail down because not everyone knows what the label means yet, and so a lot of research looking at prevalence, you can't just ask people if they identify as asexual because they might not even know what that means. So a lot of surveys, they actually have to define it and explain it to people. And as I've been talking about, asexuality is a pretty complex thing, right? So some people might have a little bit of attraction to other people and still identify as asexual, whereas other people might be like, well, I know that person identifies as asexual, but for me, I just think of myself as having a low libido, but I don't consider myself asexual. So there's a lot of different variables, so it's just hard to nail down. And I'm guessing in 20 years, 30 years, there'll be a much greater understanding of asexuality in our society, and there'll be a much greater ability just to ask people, how do you identify? It's sort of like how there, 30, 40 years ago, if you asked people, do you identify as queer or non-binary or trans? You would get a lot of people being like, no, I don't even know what these things are. And even if you described it to them, a lot of people would be like, no, not really. Whereas today, there's a fair amount of people who very quickly in the United States will say, oh yeah, I'm trans, or I'm non-binary, or I'm genderqueer, or I'm gender fluid or whatever. And that's because our society is helping people to put words to these things, and they are given a chance in some circles to explore that and find their identity. And so right now with asexuality, we're sort of in the dark ages, and so it's just hard to know how many people, if given a chance, would really identify with this. So, also because of stigma, some people might not want to answer honestly due to stigma. But in general, what it's looking like is the following. A study in Britain found that about 1% of people are asexual. Another study in New Zealand found that about 2% of the population are asexual. Another study in Finland found that about 2% of men and about 3% of women are asexual. So we're looking like about 1 to 3%-ish in that zone. In the United States, again, about 1%, similar to Britain, identify as asexual. But again, it depends on the definition and the study, and so it can be lower or higher than that, depending on how we identify that sort of thing. So just to put this in perspective, it's like, well, how many people identify as LGBT, right? And in the United States, about 4% of people identify as LGBT, according to some studies. But other studies look at it and say like, well, 20% identify as LGBT or asexual or non-cisgender. So there's, again, depending on the study, depending on the questions we ask, there's somewhere between 4 to 12% of people who don't identify as cis hetero. About 2% in the United States currently identify as gay or lesbian, and about 3% identify as bisexual. And the cities with the most LGBT, the most lesbian, gay, bisexual communities are, take a guess, top 5 cities in the United States, top 5 cities. Most people would say, of course, San Francisco has a very high percentage of lesbians, gays, and bisexual people with 15%. And Seattle is number 2 at 13%. Atlanta, Minneapolis are also tied at 13%. And number 5 is Boston. I would have thought New York or LA would have been in there, but I think it's because New York and LA just have so many people that their gay communities are pretty large. But in terms of percentage overall per capita, they aren't that high. What about gender? Well, when it comes to gender, women are slightly more likely to identify as being asexual, with about, between the, there's a lot of different studies finding different figures, but a rough estimate would be about 2/3 of asexual people are identified as cisgender women. So, just something interesting to look at. What about age? Some might think, wouldn't most asexual people be young? Well, according to the research, there's really no difference by age. Again, we're at a time where older people are going to be less likely to know what the word means. And so there's just a lot of, kind of problems with trying to look at this currently. But according to initial research in the past 15 years, there doesn't seem to be any difference in age, which really debunks the myth that asexuality is a phase that young people go through. There's a myth out there. It's like, oh, well, you're only 22 and you're asexual. Well, surely, you'll have a satisfying relationship and you'll realize that you're actually not asexual anymore. And that's a very demeaning way of looking at it. It would be very similar to saying, oh, sure, you're gay because you're in college and you're experimenting, but once you get your life on track, you'll be heterosexual. It's the same thing. Now, might it happen to somebody? Might an asexual person later change their mind or change their biology or change their psychology or whatever we want to say, change their lifestyle, as other people might say? Sure, that might happen in the same way that some people change from heterosexual to gay or lesbian or bisexual or back. There's lots of fluidity there for some people, and there's nothing wrong with that. But to characterize asexuality as a youthful thing is really just not accurate given the reality. What about relationship status? Well, about 90% of asexual people identify as being single. So, and when we look at gender, that's mostly men. So 92% of men, asexual men, identify as single, and about 80% of women who are asexual identify as being single. So, but in general, just looking at, again, this statistic, the vast majority of asexual people are currently single. Now, what does this mean? Well, it could mean that asexual people are just not really interested in relationships that much. And they're much more interested in friendships and family and all that kind of stuff. It could also be that asexual people have such a hard time finding other asexual people to be with that they just give up on relationships. Or their relationships that they've been in are so distasteful and horrible because of this difference in sexuality that they just get turned off from relationships. So it could be either. You could be just out of the, because they're not interested in romantic relationships or partnerships, or it could be because circumstances are making it so that it's really hard for them to have a relationship. Okay, let's go into some other statistics here based on studies by Bogart 2004, Prowse and Graham 2007, and other studies. Looked at trying to measure some numerical differences between asexual and allosexual people. And again, these are pretty small studies and preliminary studies, so it's hard to say, but just to report on their findings. They found that asexual people are older at first intercourse. So when they asked them, how old were you when you first had sex? And what they find is that for asexual people, the average age was 17 years old, and for asexual people, the average age was 15. So there's a full 2-year average difference between mean age of having sex for the first time, which makes sense, right? Also, asexual people have lower frequency of sexual activity. So when asked, how many times have you had sex in the last 7 days? For asexual people, the average was 0.2 times in the past 7 days. And for allosexual people, the average was 1.2 times. About lifetime sexual partners, when they asked asexual people and allosexual people, how many sexual partners have you had in your entire life? And what they found was that for asexual people, it was about 10, and for allosexual people, it was about 12. So this is actually pretty interesting because it's not that much difference, right? You would think that asexual people would be like, oh, I don't know, 2, 1 person, but the average asexual person in this study anyway had 10 sexual partners in the past. Again, small sample size. I think this particular study was in Britain 15 years ago, so maybe the figures will be different. I'm sure the figures would be different if we looked at other places, but I don't know, just sort of interesting to look at. Also, among cis women or people who have periods, I should say, asexual people have a later onset of having their first period. For example, or more specifically, the mean age for asexual people to have their first period was age 14, as opposed to allosexual people, their average was 13. So a full year difference. And this gets into ideas so that's a biological thing, right? I mean, for the most part. It's also environmental, but it is, it's not just an internal psychological experience, right? The first time you have your period. So there are some people who propose that there is a biological difference between asexual people and allosexual people, and I'll get more into that later. So let's look at the research regarding discrimination against asexual people. Research has looked into this. Shearer in 2008 found that there is evidence that asexual people suffer similar mistreatment as other LGBTQ folks. Another study, McInnes and Hodgson in 2012, found evidence that heterosexual people often view asexual people with more disfavor than other sexual minorities, and they sometimes characterize asexual people as less than human. So this is something I haven't really gone into yet in terms of the stigma and discrimination, that to some people, the notion that you would have someone who has no sexual attraction to other people is not only just politically problematic to some people, but it's such a part of our narrative of what makes us human that for some people, they're just like, oh my God, they have no sexual attraction to other people. They're like a robot, or they're like, I don't know, a bacteria or something. There's something deeply wrong with that person, and they become very distrustful of those people and therefore discriminate against them. And this study by McInnes and Hodgson, 2012, found that heterosexual people are so threatened by asexual people that they dislike asexual people even more than they dislike gays and lesbians and trans people. So that's an interesting finding, because on one hand, you'd be like, well, why would you have a problem with asexual people? Because, there's nothing in the Bible, or at least I don't think there is, that like says, people who don't have sex are going to go to hell or something. Maybe there is, I don't know. But that doesn't seem to be something that jumps into my head as something that would be moralistic. In fact, some Christians might be like, oh, yeah, you're abstaining. What a great thing that you're doing. I don't know. Anyway, my point is that intuitively, I wouldn't have thought that people would have a bigger problem with asexual people, because when heterosexual people who aren't woke look at LGBTQ people, they frequently try to envision the sexual act in their head, and if they're not used to it, it's very distressing to them. It's like, what, you mean 2 men with 2 penises? Like, how does that work? And it's very upsetting to them. And so, that's one of the reasons why they get all up in arms. But when we think about asexuality, it's like, you ask that same person, it's like, well, this person's asexual. Well, to them, they don't have to envision anything in their head, because all they do is like, well, okay, they just watch TV a lot. I don't know. And that, in my head, intuitively, I was like, well, so asexuals are probably going to have a little easier time with this. But according to the research, they actually don't, because there's these notions in our society that if you don't have sexual attraction to other people, then you're not a real human being. Also, societies have institutionalized phobia against asexuals and discrimination against asexuals. I wonder what term people are coming up with, like asexual phobia, I guess maybe would be asex phobia. Anyway, many societies have institutionalized asexual phobia. And for example, married people often have additional rights and benefits over single people or people in non-sexual relationships. So, if you are asexual, and particularly if you're asexual and aromantic, then in all likelihood, you're going to be single, right? Well, in our society, married people have a lot of benefits that single people don't. And that is just so silly to me. There's so many things wrong with that. Okay, so let's go into the DSM. I haven't talked anything about the DSM yet because I don't care for the way that they talk about it, but there is talk in the DSM about things related to asexuality, so let's get into it. So in DSM-5, we have two labels that are used that are associated with asexuality. And these two disorders are called in the literature hypoactive sexual desire disorders. Hypo meaning, below, active. So below active sexual desire disorders. Again, there are two of these disorders discussed in the DSM-5. Some say these disorders are real, and some say that they are not real, and that they just pathologize low sexual desire. But let's look at what the DSM-5 talks about. The first one to talk about is called female sexual interest and arousal disorder. Female sexual interest / arousal disorder. So for this, you have to experience a lack of sexual interest or a lack of sexual arousal. So I hope people understand the difference between interest and arousal, right? Interest is something you ask someone about, are you interested in having sex? And they're like, eh. And the other one is arousal. Like you might kind of be interested in having sex, but you have no arousal, meaning you don't get wet or boners or all the other associated biological arousal, getting worked up, your heart rate going, all the, your full body arousal experience. Some people don't have that. And so DSM is trying to look at that. And for female sexual interest arousal disorder, you need to have at least 3 of these things related to a lack of sexual interest. One is having little interest in sex. So pretty obvious there. Number 2 is doesn't fantasize about sex. Number 3 is unreceptive to sex. This is a problematic one, right? What if you don't like your sexual partner? Wouldn't that make you unreceptive? Number 4 is doesn't get pleasure during sex. Number 5 is doesn't feel much physically during sex. So, and there's a couple more there, but it's a little silly to go into them. Anyway, you need to have 3 of those. So if you don't fantasize about sex and you're unreceptive to sex and you don't get pleasure from sex and you lack sexual interest and you've had this experience for at least 6 months and it causes you clinically significant distress and it's not caused by a different disorder or relationship problems or a stressor or substance abuse, then you qualify for female sexual interest arousal disorder. Oh, and you have to be female, obviously, too, right? So in the DSM, they mention that culture may play a role, meaning that for some people, it's more common in other areas. Like they specifically say female sexual interest disorder is more common for East Asia women than in the West. So the first thing I'll say to this is that, as with a lot of these types of disorders in the DSM, it's highly subjective and it doesn't discuss it far enough. Because again, I mean, they do have this clause here that's like, well, in order to qualify for this, your lack of sexual interest cannot be due to a different disorder. Like it can't be due to anxiety or depression or medication or PTSD or something. Also, your lack of sexual interest can't be related to a relationship problem. It has to be independent from your relationship or a stressor or substance abuse. So, they include those things, which is great. The other thing is they say it has to cause clinically significant distress, which I'll get into more in a little bit, because that's a key thing, right? Because for some asexual people, they might just be like, yeah, I don't have any sexual interest, and I don't care. It's not a big deal to me. I'm fine with the fact that I don't. Whereas other people might be like, oh my God, this is such a problem. How come I don't have sexual interest in other people? But that's a subtle thing, right? Like, which we'll get into in a second. The main question I have about the stupid DSM is, why are the females separated from the males? It's just such a weird thing, right? And yeah. So number 2, the second hypoactive sexual desire disorder in the DSM is called male hypoactive sexual dysfunction. So let's get into this. Like, well, okay, if the DSM broke it out as male and female, obviously it must be like this really different condition, right? Because why wouldn't they just come, you don't have male depression and female depression in the DSM, because men and women experience depression basically in the same way. I mean, there's gender is always a factor, but it's not clinically interesting to separate female and male depression or female and male schizophrenia. So there must be a reason as to why the DSM is breaking out hypoactive sexual desire disorders into male and female. And they're even calling them different things. Because remember, the female one's called female sexual interest / arousal disorder. And then for male, it's called male hypoactive sexual dysfunction. So it's like, well, okay, so clearly if you're using different words, it must mean something different. So let's look at it. So basically, the criteria for the male version is pretty much the same. It's worded differently, but when you look at it in essence, it's exactly the same thing. And so let me just break it down. So the male hypoactive sexual dysfunction is defined as having less sexual interest, a lack of sexual fantasies, and a lack of desire of sexual activity, lasting for at least 6 months, causing clinically significant distress, and not caused by a different disorder, relationship problems, stressor, or substance abuse. Does this sound familiar to you? Sure does to me. Sounds exactly like the female version. So what the hell, DSM people? I mean, come on. Now, they will say in the male version, they do talk about that the judgment of deficiency, so the deficiency of lack of sexual desire, the judgment of deficiency is made by the clinician, taking into account factors that affect sexual functioning, such as age and general sociocultural context in the individual's life. So this is an interesting statement, and it's just one sentence, and you wish the DSM would elaborate on it. And maybe the DSM is like, look, that's not our place. That's for other literature to tackle these things, and fine. But they did mention it, which is good. But I'm confused as to what they mean by it, because it could mean a lot of different things. Because if we just look at this, right, at the first sentence or the first bit of it, it says, the judgment of deficiency, so again, the judgment of sexual interest deficiency, is made by the clinician. So this one phrase makes it look like it's a top-down evaluation, right, where the clinician is saying to someone, you have male hypoactive sexual dysfunction, rather than asking the person, do you care, or do you identify as having a sexual dysfunction, or would you rather identify as being asexual, right? So that part of it doesn't sound so great, but then the rest of it is I can get on board with. Taking into account factors that affect sexual functioning, such as age and general sociocultural context of the individual's life. So if you are 95 years old and you have very little sexual interest, then maybe we take that into account and say like, well, it's not uncommon for 95-year-old people to not be interested in sex anymore. Now, there's plenty of 95-year-olds who are super interested in sex. So, that's something to think about. But, if you're 95 and you've already suffered a lot of different surgeries and different, you've had a couple strokes and your spouse died 20 years ago and, you haven't had an erection in 20 years or something, it's not, unusual to be like, sex, not a big deal. Now, having said that, like I said, plenty of 95-year-olds super into sex, but, so they take age into account and also sociocultural context of the individual's life. So if you lost your job and you're being marginalized and you're in an abusive relationship and all these kinds of things, then take that into account. If they lack sexual interest for more than 6 months and it's causing them distress, maybe we don't pathologize that. Maybe we look at that as something that's contextual. Now, with some people that love the DSM, they'll say, look, just because we have a label in the DSM doesn't mean that we're pathologizing it, so to speak. It could just mean that we're providing a label for some people's experience so that we can focus on it clinically. And I can get behind that for the most part, but there's a lot of things that are not in the DSM that we all target clinically. If someone has attachment insecurity, we all know we're supposed to, address that. That's not in the DSM. There's a lot of things that are, if someone has a conflict in their marriage and they're having trouble communicating, we focus on that. That's not in the DSM. We don't have to have every goddamn thing in the DSM. We don't have to do that. And I think that this is probably one of those things. But anyway, so again, why is it gendered? Why do we have a male version and a female version? And why is it called something different? I mean, again, the female one is called female sexual interest / arousal disorder. And the male one is called male hypoactive sexual dysfunction. And I don't want to, I hate it when people read too much into things, but if I was to do that with this, if we just look at the female label in the DSM, female sexual interest disorder and female interest arousal disorder. So it's like, if she's not interested in sex, it's a disorder, right? An interest disorder. And so, we got to get her to want sex, okay? This is me looking in the dark side of this. Whereas the male hypoactive sexual dysfunction, it's like, well, surely men are interested in having sex. So there's some sort of dysfunction happening that's making it so that, because erectile dysfunction, the word dysfunction feels more male sexual problem-y, right? And sexual interest disorder sounds more female-like in our society. But again, I see absolutely, and you DSM people, tell me the difference between these two disorders in the DSM. They are definitely worded differently, and you could point to some differences, but the just behind the wording is a very clear, identical set of criteria, lack of sexual interest, lack of sexual fantasies, lack of desire to have sex, 6 months, distress, and not caused by some other thing. So, yeah. Now, having said all that, I hope that I can say this very clearly. There are many people who I think would absolutely qualify for these disorders and would be helped by it. For example, take someone who they grow up, they like to masturbate, they like to have sex occasionally, and then they get married and they find that their libido is dropping and dropping and dropping. And it's not due to a medication, it's not due to taking the pill. Their relationship is going relatively well. It's not perfect, no marriage is. But, things are going relatively well in their life, and they've just slowly lost interest in sex. And they're very upset by it. They're like, how come I used to like sex? I used to want to have sex. And now, man, I have no interest in having sex. And when you talk with them, you're like, well, there's this thing called asexuality. And it's where people identify as asexual and they say, you know what, I'm not interested in sex and I'm cool with it. How does that feel to you? And they mull that over for a couple months, maybe a couple weeks, maybe a couple days. And they say, no, I'm not asexual. I don't want to live like that. I'm a sexual person. I identify as an allosexual person. I want to have sex, and I want answers. I want to figure out why I no longer want to have sex. Please help me. I'm in a lot of distress about this. My marriage is falling apart, and I agree with my partner that we should be having sex. And there's got to be an answer. Maybe sex therapy, or maybe something's happening in my head, or maybe I need to recover from trauma or something. And what's happening to me right now? So in that case, then I say, fine, let's use a DSM label. I still don't think we need it, honestly, but, fine. Particularly if insurance companies are going to pay for it, then, all the better. So those are people that legitimately, in my mind, have justification for us using labels of hypoactive sexual desire disorders in the DSM. Now, I don't know why we have to gender them as male or female. Plus, like, what about trans people? We don't have, at current situation, trans people have no hypoactive sexual desire disorder in the DSM. We have to put, if we're going to label you, we got to call you female or male, which, they wrote the DSM-5 in 2013. It's not like trans issues were unknown to these people. Why wouldn't you just combine these two? I don't understand. The DSM authors have some of the most backward thinking. It's just mind-boggling. Okay. So when we look at these hypoactive sexual desire disorders in the DSM, the key to these, in my opinion, is this idea of distress. So how do we define distress, right? So we've talked about this before in other situations with paraphilias and these kinds of things. Now, if you are asexual, or say you've never had sexual attraction to other people, well, you're going to experience distress because, one, you're going to feel different than other people in the world. You're going to be like, man, there's something different about me. And I don't feel like there's room in the world for who I am. You might even reach out to people and they might be like, oh man, what's wrong with you? They might stigmatize you. You might be ostracized or humiliated in certain ways. And you might feel like you don't like a lot of movies or TV shows or something because everything centers around sex. And so, yeah, you're going to experience a lot of distress by the fact that you don't have any sexual interest in other human beings. But whose fault is that? It's our fault. It's society's fault. It's not the individual's fault. It's our stupid society's fault, right? The fact that a gay person, for example, experiences distress because they're gay is not because it's inherent in the experience of being gay. It's inherent in the experience of our society, right? So, but when we're looking in the DSM, for the vast majority, if not all labels, there has to be what they call clinically significant distress. So, for example, you could be depressed, but if you aren't experiencing clinically significant distress, then it doesn't rise to the level as something we would apply the label in the DSM. So when someone lacks sexual desire and they don't have any fantasies and they don't have a desire to have sex with other people, well, and they have it and they have distress about it. So there's there's three different options, three different possibilities. One is if someone comes to your office and says, I have no sexual interest. I have no sexual desire to have sex with other people, and I don't fantasize about sex about other people. And you know what? I'm totally cool with it. I have no distress. In that situation, I hope that people looking at the DSM would be like, oh, okay, well then they don't qualify for these labels. And in fact, there is literature and the societal notion of called asexuality, and you'd say you sound like someone who's asexual, because you lack sexual interest in other people and you're cool with it. So there's a label for that. It's called asexuality. How do you feel about that? So you explore it. The second possibility is they come in and they say, I lack sexual interest in other people and I have tremendous distress about it. Okay, now in this situation, you have to determine, is that distress because of society or is that distress because of an internal sense of distress? Now, I'll get into more of this later, but this requires a fair amount of exploration. You can't know just by a short conversation with someone, because have they, for example, just going to the gay analogy, someone comes to your office and they're like, I'm a man and I'm attracted to other men and I have tremendous distress about it. Now, if you said to them, well, where does the distress come from? Does it come from society or does it come from you? And they're like, well, it comes from me. And you're like, well, what do you mean? Why are you distressed about being gay or having, being attracted to men? And he might say like, well, because it's disgusting. Being gay is gross and I'm going to go to hell. I'm extremely distressed about this. Well, most of us would say that is internalized homophobia, and let's address that and your distress will go away. And you can be gay, It's much more complicated than that, but it's not a bad simplification of it. So when someone comes to your office and says, I have no sexual attraction to other people, and I have tremendous distress about it. And you're like, well, why do you have distress about it? And they're like, well, because it's unnatural. It's terrible. Human beings are supposed to have sex with other people. It's not normal. And even after you explain asexuality to them, and they're like, no, 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 no. Not being attracted to other people is terrible. And I'm getting a ton of grief from my spouse, and my parents want me to have more kids. And, I just don't know what to do. I'm in so much distress. Well, is this society? Is it internalized phobia against asexuals? That's a very difficult thing to tease out. And in my opinion, requires a tremendous amount of exploration, which could take actually a long time. I mean, I've gone down that road with people before for a lot of issues related to sex, because we've been so programmed from such an early age to believe certain things, and it takes a long time for people to suss through that, particularly if you weren't raised very well to begin with, and you have a hard time with your sense of self anyway. And but having said that, I would say, contrary to being gay, there are some people who lack sexual desire whom I believe, after fully exploring it, I'm confident in the client's ability to evaluate for themselves that no, my distress is not internalized phobia against asexuality. It is a genuine distress that I feel that is a result of my true identity, quote unquote, not being able to shine through my situation. I'm a truly allosexual person, and deep down, and I need you to help me to help that emerge. Now, again, that's not analogous to gay people, because you wouldn't have a gay person say, deep down, I'm a heterosexual person, and I need that to emerge. Now, you see the rub there when it comes to asexuality, right? Since asexuality is a sexual orientation, should we be discouraging people who exhibit asexuality from, framing themselves as deep down and allosexual, right? It's an interesting conversation. To me, as a clinician, I just explore it with people. I just keep exploring, and I let them do whatever they want. And wherever they go, that's where they go. And I just try to remain as open as possible. So that's a key bit of understanding when we come to DSM-5, because both, the male and the female version of the hypoactive sexual desire disorders have a major clause in there that says causes clinically significant distress. So, because for some people who lack sexual desire, they have no distress about it, so they're cool. And actually, when we look at empirical observation of asexual people through a number of studies, two by Brado and colleagues 2010, and Brado, Ewell, and Gorzalka 2015, they found the following things. For example, they found that only 10% of asexual participants indicated experiencing distress. So 90% of people who identify as asexual will say, I have zero distress about the fact that I'm asexual. I'm totally cool with it. Another study found that individuals classified as asexual report much less distress than people who meet criteria for a hypoactive sexual desire disorder. So that's just something to keep in mind. Researchers have asked asexual people how they feel about these diagnoses being included in the DSM-5. They said, so there's these labels in the DSM-5 that pathologize people who lack sexual desire. Let me explain how they work, and how do you feel about it? And surprisingly, according to this one study, that they found that the asexual participants said that they actually liked the labels in the DSM, and they support clinicians in their efforts to develop treatments for them. So I'm guessing that they saw these labels as not encompassing them. They're like, well, yeah, I mean, if someone has distress about the fact that they lack sexual desire, then I suppose they should get a label and they should get treatment for that label. So, they're fine with that. So it seems that asexual people, at least in this one study, they're just like, look, I'm totally confident in the fact that I don't have a pathology, but I could see some people being labeled as having a pathology because they're really upset about the fact that they lack sexual desire. But for me, I've always been cool with the fact that I don't have any sexual desire. But these people in this study, they did want a greater emphasis in the DSM on distress being explained in more detail because it can come from society or from spouses or other people. So they're like, that distress clause in the DSM needs to be explained more fully so that clinicians don't mistake stress from society or stress from spouses as distress that should be considered relevant. And they also advocate the DSM have a clause specifying that the diagnosis applies only to people who do not consider themselves asexual. So this is interesting, right? That they're like, look, that's fine if you want these labels to be the DSM, but there should be some clause in there that says that if the person identifies as asexual, they cannot qualify for these labels. Because if they identify as asexual, by definition, they're okay. They've wrestled with it sufficiently, and they're okay with the fact that they lack sexual desire. And this is interesting because what this would mean was that, say a client came to you and said, I don't have any sexual desire, and I have some distress about that. I have clinically significant distress about that. I'm kind of upset, and I don't know what to do about it. But I just want you to know, I identify as asexual. In that instance, according to this recommendation from these asexual people, they don't qualify for one of those disorders in the DSM. And I think that's right. I think it should be that way. So it doesn't take away the fact that they lack sexual desire, and it doesn't take away the fact that they are reporting they have distress about that. But what it does is it says, we can't pathologize someone who identifies as that thing. Do you know what I mean? Anyway. Okay, so let's look at some correlates. Okay, we're about 2/3 of the way through, and we're at the 2-hour mark, so it looks like maybe about another hour. Okay, so let's look at what things correlate with asexuality. Well, a lot of researchers have looked into biological correlates. So they look for, what's different biologically about asexual people. Now, what I will say from the onset is that the research has found some things, but they're not very strong signals in the data. It'd sort of be like saying, assertive people tend to be taller, for example. I don't know if that's a thing, but let's say that was a finding. Well, we wouldn't say like, well, if you're short, you're definitely not going to be assertive, right? And you also wouldn't say that being tall makes you assertive, right? You would just say like, well, maybe, when you involve all the different factors, maybe being tall might just slightly increase your chance of being assertive, according to this assertive scale or something. So just keep in mind that notion of statistics as we go through this. But overall, the research, when they look at biological correlates, similar to being gay or lesbian or bisexual, they're often looking at atypical prenatal environments. So you have what they call typical prenatal environments for a fetus, and you have atypical. And when you have an atypical prenatal environment, that leads to different anomalies, shall we say, in biology and in psychology. So one of the things that they have found that is associated with asexuality is being left-handed. So this is actually true for other non-heterosexual orientations. So being gay, being bi, being lesbian are all associated with being left-handed, and so is asexuality. So the idea goes is that due to some abnormal condition on the fetus, it results in two things. One, left-handedness, and in not being heterosexual and not being allosexual. So now, obviously, there are some political problems with that statement, but that's the idea that they're going for here. Number two, another biological correlate is birth order. So this is actually a well-studied area that many of you might know about. The idea goes is, and it's just a theory at this point because it's hard to know the answers to this because we can't experiment on humans. But the theory goes is that if you're a mother and you have a baby boy, then there are certain biological, I'm not a biologist or a obstetrician, so I don't know the language, but so I'll probably butcher this, but the idea goes is that when you are a mother, you are a female and you have a baby growing inside of you. And if that baby is a boy, then the body reacts to it a little bit as if it is a foreign object. Not entirely, obviously, but potentially slightly. And so the body, the immune system mistakes the male fetus as something that is a foreign body. And if it's a female fetus, then it's less likely to react to the fetus in that way. And so the mother might develop an immune system to the male fetus. Then with each successive male fetus that the mother has, so say, son number 2, son number 3, son number 4, by the time we get to son number 4, the mother's immune system has developed a robust reaction to the XY chromosome in the mother's body. And this can lead to a atypical prenatal environment for that fetus, which can result in being left-handed and also in being gay and being trans and also in being asexual. So that's one of the theories. Because what they do find is that if you are the more older brothers you have, the more likely you're going to be gay. And also what they find is the more older brothers you have, the more likely you're going to be asexual. So, it's just interesting to look at that. Number 3 is finger length ratio. So this is if you look at your hand and hold your fingers out straight, if your ring finger is close in length to your pointer finger, then this is associated with asexuality. Again, because there's an atypical prenatal environment, it results in a deviation from the norm in terms of your finger length, and also it leads to a deviation in norm in terms of sexual attraction. Number 4 is being shorter. Asexual people tend to be shorter. But other studies have found there's no association between height and asexuality. Again, because there's not a lot of great studies out there, and so it's hard to know. Number 5 is low circulating testosterone. A lot of studies looking at this, meaning that if you have low circulating testosterone, then you're more likely to be asexual. And the idea goes, again, that due to abnormal or atypical prenatal environments, this can result in having a atypical testosterone system, which can result in atypical sexuality, namely being atypical sexuality, namely asexuality. But they've done research on rodents and found no difference between non-copulating rodents and copulating rodents. Again, this is observing rodents from afar, so you can't ask them, are they sexually attracted to other rodents? You just have to watch their behavior. So there's a lot of different reasons why a rat will not have sex with anyone else. It's impossible to know what their inner experience is, but and also these kinds of studies assume that rat studies are applicable to humans, which they often aren't. But anyway, there's been other research that's pointed towards testosterone is not necessarily a significant factor in developing asexuality. And number 6 is elevated physical health issues. There's been a number of studies finding that asexual people tend to have more physical health issues than others. So there's 2 theories about this, 2 hypotheses. One is that, again, due to an atypical prenatal environment, you develop both physical ailments as an adult or a person, a child, as a post-born person, you develop more physical illnesses, and you also develop atypical sexuality, namely asexuality. Another explanation, which seems more intuitive to me, which is that due to the fact that you have physical health issues, that absolutely can interfere with your desire to have sex with other people, right? So is it the chicken or the egg? Hard to tell, but it is something that is found. So those are the six. You have left-handed birth order for males, meaning you have more older brothers. Finger length ratio being shorter, low circulating testosterone, and elevated physical illness. These are all things that are correlated with asexuality. But much of this research is preliminary, so we could find in 20 years that none of these things matter, or maybe there's even a stronger association. But so we just have to take it with a grain of salt. And there are studies that contradict these findings. There's plenty of studies that say finger length ratio has nothing to do with asexuality. Because again, as I was talking about earlier, the definition of asexuality is different depending on who's talking. And you're asking people to tell you about their inner experience. So, it requires, when you study how tall someone is, you don't have to ask them about their inner experience. You just measure them from foot to their head, right? But when it comes to these kinds of research designs, you have to ask someone, tell me your inner experience, which requires one, that they know their inner experience, two, that they know what you're asking, and three, that they tell you the truth. And there's a lot of possibility in there of it getting thrown off. Whereas when it comes to how high you are, as an analogy, let's just imagine that we had no ability to measure how tall someone was. And we did a national survey and we just asked people, how tall are you? Well, and the person doesn't know how to measure themselves either. So no one knows how to measure themselves. And the way that we describe how tall we are, we actually have no way of measuring inches and feet and everything. We just have to say, well, I'm taller than Brad Pitt, or I'm about as tall as a horse or something. So that's essentially where we're at when we're asking about anything psychological. We're calling people on the phone, and without any way of measuring, length, we're asking people, how tall are you? What's your experience of how tall you are? They'd be like, well, when I walk through a door, I do pretty well, and I can reach the top shelf most of the time. And you're like, well, what top shelf? What kind of top shelf? Is your top shelf the same as my top shelf? Well, that's what we're talking about when we're asking people about asexuality. We're like, how sexually attracted are you to other people? And the person would be like, I'm not really that sexually attracted to other people. Well, what do we mean by that? Is their yardstick the same as the researcher's yardstick? These are very difficult things. So when we look at correlates like being shorter or finger length ratio, we're looking at things that are mathematically discrete, like finger length ratio and being shorter, and comparing and trying to correlate them with something as squishy as asking people to self-report about their sexual attraction in general to other human beings. And of course, that question doesn't exist in a vacuum. There's a context, there's, all these sorts of things. So anyway, plus, like I said, tons of research that totally refute this. You have asexual people who are right-handed, you have asexual people who are firstborn, you have asexual people with a ring finger that's longer than their pointer finger, you have asexual people who are tall, you have asexual people with high or normal testosterone levels, and you have asexual people who don't have any physical problems at all. So it's just important to point out. And honestly, I dislike this emphasis on biology in the literature. Whenever we're discussing sexual orientation, there's a subsection of our field that feels compelled to look at biological correlates. There's two reasons why I think people do this. One is that they're trying to pathologize asexuality. They're like, ooh, asexuality is weird. Well, maybe it's because they were born with a disorder, and if I can prove that there was something wrong with their bodies, then that's why they're asexual. And of course, that's not cool, and I think not relevant to our situation. Plus, even if it were true, you wouldn't be able to demonstrate it given the lack of our ability to quantify psychology and drives and everything. The other reason why researchers do this, which I think is more common than the first one, is that they're trying to depathologize asexuality. And I've talked about this before when it comes to LGBTQ people, that when we look for reasons to say, well, look, this is a biological thing. People are born gay, or they're born trans, or they're born asexual. I get why we point to that as a way to try to legitimize it. You know, it's like, well, some people are, you know, God made you that way. I get that. But there are problems with that. One is that for some people, they will phase in and out of asexuality or being gay for that matter. So that would, you know, mean that, wait, so they're not really asexual, they're not really gay because they only identified as being asexual starting at the age of 45. So they're not really gay, or they're not really asexual. So it's problematic in that way. But the main problematic thing is that when we use bad science to prove a good idea, people who oppose the idea will find it very easy to refute the idea. And the fact is we have no way of knowing with our current technologies how people are born with regards to sexual orientation. We just don't know. And we probably never will know. And once we do know, I'm guessing it will absolutely be a combination between nature and nurture, with certain factors being perhaps more strong in others and less in other people. So the notion is well refuted, is easily refuted. So if you're trying to depathologize or legitimize asexuality, I say don't pick a line of argument that is easily refuted. Pick a argument that cannot be refuted. For example, the argument that I would say to legitimize asexuality is, why the fuck do you care? That's my statement. You know, if someone's like, hey, asexuality, it's not really a thing. And what I'd say is just like, well, fuck you. And two, like, why do you care? Why do you care how someone else identifies? Why do you care if someone else has or does not have sexual desire, or what degree of sexual desire they have, or how acceptable it is regarding their sexual desire? What's it to you, pal? Why do you have to look at that with anything other than either just neutrality, just be like, well, who cares about that? Or at the very least, just appreciation, like, good for you, great. I'm glad you've discovered yourself, you know, it's good for you. You know, why would there be any stigma about that? And why would it not be legitimate? In the same way that someone who says they're trans, you know, they're like, you know what? I was born with a penis, but I absolutely identify as female. And what anyone should say to that is like, fine, good, great. What can I do to help? What do you need? I'm here to help. There's no reason why you should have any other reaction other than that. Why would you care? When people ridicule, who is his name? The Kardashian who's trans, Jenner, Caitlyn Jenner, I believe. Why in the world would anyone look at her and say what's wrong with her, or she's not really a woman, or, it's like, who cares? Just let it go. It doesn't harm you. Just who cares? At the very least, who cares? And at best, appreciate. Anyway, so that to me is the best argument against people who want to delegitimize or pathologize asexuality, is just to say, what's it to you, pal? Like, why are you doing this? Also, another thing that we find in the research literature, namely Manning 2002, is that high musical talent is associated with unusual prenatal events. So, in other words, when you have a atypical prenatal environment, this is somewhat correlated with having high music ability later in life. But we don't pathologize that, right? We're just like, well, that's a happy accident that a atypical prenatal environment resulted in you being a brilliant pianist or a brilliant composer. We don't put that in the DSM. We don't say like, oh, that's a pathology, right? So just because something atypical leads to something also atypical doesn't mean that it's pathology, right? So if you have an atypical prenatal environment and it leads to you having an atypical sexuality, like being gay or trans or asexual, that doesn't mean we pathologize it in the same way that we don't pathologize high music ability, right? Also, and I found this in one, I can't remember where I saw this, but I found it to be very compelling, is that sexuality, allosexuality itself is associated with a lot of bad things in our society and a lot of bad things among individuals, right? Being sexually attracted to other people has a lot of bad side effects. Rape culture, sexual assault, sexual objectification, sexual harassment, Kavanaugh, all these kinds of things. So, and yet we don't pathologize allosexuality, right? We don't say that we need to make everyone asexual, right? So just because there might, and I can't really think of anything along those lines among asexuality, right? So if anything, society-wise, we should be like, you know what? It'd be a good thing if more of us were asexual because there'd be a lower rate of rape, lower rate of assault, lower rate of objectification and harassment. Now, having said that, I didn't see any research showing that asexual people are less likely to rape, for example, because I can absolutely see someone who wanted to harm other people and they also happen to be asexual could actually harm other people. So I haven't seen data on that, but I hope you get my point, is that we shouldn't be pathologizing asexuality. That's a very silly notion to do. Having said that, we absolutely can use some of the DSM labels for some people after they have demonstrated to us that they have explored fully and have told us through a collaborative exploration process that they don't suffer from internalized asexual phobia, if that makes any sense. Okay, so those are the biological correlates. What about the psychological correlates? Well, again, it's difficult to know because of the uncertainty and the gray area and the amorphous nature of the research. But there are a number of things that they found in the research that are associated with asexuality, namely difficulty knowing and describing your emotions, otherwise alexithymia. This is a condition that, so difficulties with your own emotions, like you're not really quite sure what emotion you're having, and you have difficult time describing your emotions. So this is associated, so some people who are asexual also have this, a minority of people, or there's greater rates of this, which kind of makes sense, right? Like if you don't know your emotions, you might actually be kind of cut off from your own arousal and your own sexual desire, right? Okay. Number 2 is interpersonal functioning. So when people have difficulty, in relationships with other people, for example, people on the autism spectrum, they are more likely to be asexual. Having said that, not all autistic people are asexual by any means. Number 3 is depression, which I've already talked about. If you're depressed, one of the markers of depression is a lack of sexual desire. Because in reality, a depressed person typically lacks desire to do anything. They lack a desire to go skiing or to even watch TV. When you become severely depressed, you don't even want to leave your bed. You just stare at the ceiling. You just can't get yourself to do anything, let alone have sex with people. So depression is correlated with asexuality. Number 4, autism spectrum disorders specifically are, so not just interpersonal functioning as it relates to autism, but actually autism itself is related to asexuality. Number 5, not number 5. I'm just looking at my notes here. We should know that not everyone with who identifies as asexuality has these 4 or any of these 4. But these are just some of the things that studies have found. Okay, so we've looked at biological correlates and we've looked at psychological correlates. Now let's look at sociodemographic correlates. There are 3 of them that have been found in the research. Number 1 is lower education level. Some research, Poston and Baumel, 2010, found that people who are asexual tend to have lower education levels. However, other research found the opposite. Prowse and Graham, 2007, found that asexual people had higher education levels. And yet other research found no difference between asexuals and allosexuals regarding education level. Brotto and Ewell, 2011, found that. So hard to say. Seems like we don't really know regarding the correlation between education level and asexuality. I would say, in conclusion, there probably isn't a correlation. But Some people talk about lower education level in the literature. Number 2 is higher religiosity. Bogert in 2004 found this. So the idea is that people who are religious have a greater likelihood of being asexual. We don't know why that is, but speculation is that some religions shame sexuality in general and might encourage asexuality among its members. And another speculation is that as an asexual person, you might turn to religion because it might be a refuge away from the stigma in the broader society. Some people might feel like, well, if I go into a church and I'm asexual there, they might actually accept me, whereas in the broader society, I'm stigmatized. Hard to say, but there is a correlation there between higher religiosity and asexuality. Number 3, the third sociodemographic correlate that is identified in the literature is lower socioeconomic status or level is associated with a greater likelihood of being asexual. Poston and Baumel, 2010, and Bogert, 2004, found this factor to be true, or found this factor to be correlated with asexuality. But again, asexual people can have none of these. They can not be religious and not be of lower socioeconomic level. There's asexuals are a wide variety of people. And so, I guess the bottom line is that there aren't a lot. So when we look at all the correlations, the biological correlates, the psychological correlates, the sociodemographic correlates, the gestalt that I hope you come away with is that asexual people vary in all the same ways that allosexual people vary. You wouldn't say like, well, if you're rich, you're more likely to be allosexual. So, there's just a lot of variety among asexuals, and so we can't really, according to research, put them into a box. The one thing that I will say is worth looking at is that autistic spectrum people are a little bit more likely to be asexual, which makes sense, right? Autism spectrum people sometimes have trouble with relationships in general, or they're not super interested in those kinds of relationships. They might be interested in family relationships and friendships, but not in romantic or sexual relationships. And also being depressed. If you're depressed throughout your life, like you suffer from, low grade or moderate depression since you were a teenager, there's a chance that you've never experienced, due to your depression, a significant sexual arousal or interest in other people. It's a similar thing to say that if you're depressed, you might not have ever experienced a good night's sleep, right? Because as a result of your depression, it makes it so it's really hard to sleep at night. And so you've never had a week of just really restful sleep. Well, in the same way that if you're depressed for years and years, it's possible that you've just never experienced sexual attraction to another person. Again, this is not the majority. The vast majority of asexual people are not depressed and not on the autism spectrum. So we don't want to, look at those things as super related, but it does make sense that if you're depressed, if you're autistic, especially if you're depressed for a long period of time, that you have a greater chance of identifying as asexual. But again, the vast majority of people who are asexual, in a nutshell, we would conceptualize them as essentially being born that way, and it's not a result of some other factor like depression or autism. All right, let's go into whether or not asexuality is an orientation. We've already talked about this a little bit, but in the literature, they talk about different criteria for a orientation. What criteria need to be met in order for us to say, yes, that qualifies for an sexual orientation? Like, just to throw out an example, let's see what comes out of my head. Let's say that you can only get off if you, well, I don't know if this is going to work because there's going to be a lot of potential sexual orientations that can be developed. Anyway, never mind that. So let's just go over what in the literature they talk about are the criteria for sexual orientations. So number one, is it stable over time? So in other words, is your sexual orientation stable, over an amount of time? Now, in the literature, they don't talk about how long that needs to be because it seems kind of silly to, create kind of a cutoff point. But in other words, it can't be something that is brief or fleeting. It has to be something that is, fairly stable over time, that you are oriented toward a particular target or towards no targets at all for a long period of time. So that's one criterion. Number two is, were there hints early in life? So some research has found that many asexual people will say that they always felt that way. Research by Van Houdenhove et al., 2014, Sage, 2013, Wilson and Rahman, 2005, found that many people of various different sexual orientations other than heterosexuality will say that they felt this way from a very early age. Now, having said that, some asexual people will say that they didn't notice they were asexual until they were older. And there's still other people who found that they were very attracted to other people, and then at a later time in their life found for many years that they had no attraction to other people for various different reasons or for no detectable reason. So there's a wide variety, but some people consider a sexual orientation, in order for it to qualify, it has to have hints early in life. This is lending itself towards, or this is catered towards the theory that sexual orientations are something that you're born with or that you develop very early in life, which I don't agree with. Number three is it just a reaction to trauma or circumstance, or is it something else? So this is another question that some people in the literature will put forth as a criterion for sexual orientation. So in order for it to be a true sexual orientation, it can't be just a reaction to trauma. So if you were traumatized sexually and therefore you don't want to have sex with anybody, then according to some people, they would say that's not a sexual orientation. In fact, you might not actually know your true orientation because your true orientation is being screwed with by the fact that you were abused and therefore have a phobia for sex. You might actually be asexual, but we won't know until you recover from that trauma. I disagree with this one as well. I think that people can identify however they want to. I actually don't agree with any of these criteria. I think that it doesn't have to be stable over time. Your orientation can absolutely switch on a minute-by-minute basis if it feels that way to you. There's nothing wrong with that. Also, like I said, certainly there are people who have hints early in life of their sexual orientation while others do not. And also, even if it is a reaction to trauma or circumstance, and that's how you want to identify, then I say go for it. It's silly to put criteria on that. Because as I was saying earlier, it's like, well, what's it to you? What's it to you if in my head, minute to minute, I'm like, I'm asexual. I'm allosexual. I'm gay. I'm straight. I'm trans. What's it to you that I am doing that? It doesn't affect your life at all. It doesn't mean anything to you. There's no benefits. I'm not in a different tax bracket because I identify in a certain way. And if I want to incur the stigma associated with all those things, then I have the right to do that, right? And so you can't be thought police in this world, and it bothers me when people do that. Now, having said that, 99.999% of asexual people are not like that, right? The vast majority of asexual people are just like, yeah, I've sort of known for a long time, and now when I really think about it, when I think about me, that's the best label that I can think of. I am asexual, or I'm demisexual, or I'm gray sexual, or whatever. And the vast majority of people are fairly consistent over time. But like I said, if someone isn't consistent over time, what's it to you? Okay, let's move on here. The next thing I want to talk about is the LGBTQIA lettership, shall we say. So we all know about LGB. So when I was coming up in the field, they actually called it GLB. It was GLB, GLB. It was gay, lesbians, and bisexuals. And then in my field, I don't know, maybe 20, 15 years ago or something, they added the T. And they changed it to LGB to, I believe, so that it wasn't always favoring men first. And so it was LGBT. And then we started going LGBTQ, Q for queer. And then people, or questioning was, some people say the Q stands for queer and or questioning. And then in the, I don't know, maybe 5 years ago, we started using the letters LGBTQIA. So the I stands for intersex, and the A stands for asexual or allied. And then other people would just say, how about we just say LGBTQ plus, they would say. And so there's a lot of different, conventions going around. In my world, people tend to use LGBT or LGBTQ. Q, for some people, that is supposedly an umbrella term that captures everyone else. It's just like if you're, gender fluid and you don't identify as trans, or you're asexual, or you're intersex, or even if you're an ally. I guess queer doesn't count allies. But anyway, so there's been some hubbub in the community regarding including asexual people. In my world, when people are being fully, comprehensive, they will use LGBTQIA. In fact, I think I discovered what that meant on the podcast about like 5 years ago. I think Rebecca came on the podcast and she was saying LGBTQIA, and I was like, wait, what's the IA? So about 5 years ago, I was hip to that. But so in my world, in academia, where people don't scream at each other like they do on the internet, it's just basically accepted that LGBT is okay. Obviously, you can say, and people aren't offended if you just say LGBT. You can certainly say Q, and you can certainly say IA. But when people are being comprehensive and buttoned up, they will say LGBTQIA or LGBTQ plus sometimes. Anyway, the point is that there's not a lot of hubbub, but on the internet there is some hubbub about whether or not asexual people or even allied people should be included in the letters. And what I'll say to that is, I don't know. These are my feelings. So I'm not the governor of such things. I am an ally, and there's that. But I am not in the LGBTQ intersex asexual community myself. So I just know that I'm an outsider commenting on it, and I'm not a scholar on the matter. Some of you people out there are probably scholars in LGBTQIA issues and concepts, might even be asexual scholars, and already you're probably throwing your phone at the wall at some of the language I'm using or some of the vibe I'm giving. But anyway, so just take what I'm about to say with a grain of salt. I think asexual people should absolutely be included in the LGBTQIA consortium, shall we say, because being asexual is a sexual orientation, which I think is undoubtable, and they will absolutely experience discrimination. As I said, research has found that they experience discrimination the same as LGBT people, and might even experience greater discrimination because of the way people view it as not being really human. Today, people who are not woke might actually find it easier to identify with a gay person because at least that person wants to have sex than it is for them to identify with someone who doesn't want to have sex with someone at all. Apparently, that's what research is showing. Some research is showing. So you have the key components of being included in this group. You are a sexual orientation, and you are absolutely discriminated against in this society. Now, if we really used those criteria for being included in the letter consortium, then, a lot of things will start to get included, right? I have heard about polyamory people being included. What about fetishes, right? I mean, if you have a fetish for shoes, for example, and you can only have sex when a high heel shoe is involved, well, you could argue that's a sexual orientation, right? And you are absolutely stigmatized in our society. So should we include paraphilias in it? And I also know that some pedophilia people will argue that they deserve to be included in the group. They will argue it's a sexual orientation, and they're absolutely stigmatized. So, I don't know the answer to it. It's not to me to decide. And I grew up in a time when we used the term sexual minorities. We just blanketly called everyone a sexual minority. In fact, the agency in Seattle that focuses on LGBTQIA folks was called it was Seattle Counseling for Sexual Minorities, I think it was called. I don't think it's called that anymore, or it shouldn't be called that anymore. Because I think that term sexual minority is not preferred. But anyway, so I've grown up before they even used GLB, and so things are evolving, and I'm totally fine with that. I think it's a wonderful thing to me to witness the evolution and the progression as a society and as a community. I think it's just fantastic. So, if we end up with 25 letters, that's fine as long as I can memorize them all. I'd love to destigmatize all the groups, and I think it's definitely worth it. And, some people will say, well, why don't we just come up with one word for all of it? And, there's some argument for that. And that's what queer is kind of becoming a little bit. But again, queer doesn't encapsulate everybody. The poly people don't identify as queer necessarily. Asexual people certainly may not identify as queer. So I think that it is a good idea that we individually honor and identify different groups, because each group has a different educational task with society. And when we include, so for example, when we added the T, right, it was LGBT, a lot of people are like, wait, what does the T mean? And you have to say, well, it stands for trans. Well, what does that mean? And so now there's this opportunity for people to learn this sort of thing. Whereas if we didn't include that T, how far backward would we be regarding society? So that's my opinion, and I'm sticking with it until I am convinced otherwise, which, may happen. And by the way, there are reports of people being quite nasty within the LGBTQIA community, where they will say that asexuals are not allowed in the community. They will say, no, you are a bunch of blah, blah, blah. And that's certainly not the majority of people. But online, people can be nasty. And the interpretation I have of that, because there's been infighting, what I'll call infighting, with every step of the way. I remember in the 90s, there was resistance between gays and lesbians actually banding together. In the 90s, there were gay people and lesbians who actually didn't want to be associated with the other group. I remember that. They'd be like, no, I don't want to be, with lesbians would be like, I don't want to be lumped in with gay men. I don't like any gay guys. I don't want to be associated with men. We should have our own group. Why are we calling ourselves GLB? I don't want to be lumped in with that. And then when gays and lesbians were looking at bisexuals, there was some infighting regarding that, saying that you're not really a sexual minority because you're bisexual, you're just experimenting and stuff. Obviously not all gays and lesbians were having those thoughts, but there were some. And then with trans, it was a similar thing. It's like, hey, you're trans, you're not a sexual orientation, you don't deserve to be in our group. And so every time it opens up, there's some discussion, and then there's some fringe opinions, shall I say, where people are screaming at each other. And, I suppose it's all part of the discourse. I just wish people weren't so nasty to each other. And my speculation about that nastiness is that when you are an oppressed group, you incur and internalize a tremendous amount of hatred and oppression and discrimination and marginalization and bias from the dominant community and the dominant society. when you're a trans person and you're just walking around the world, you are incurring just minute by minute mistreatment and dirty looks and institutionalized transphobia. And, it's just a very stressful life, right? And I mean, not for everybody, but, we can imagine for many. And there becomes this toxicity that you sort of internalize. And then when you finally sort of eke out your place in your community and maybe even in our society, and you're like, ooh, I am now part of the LGBT community. Well, and then someone else tries to get in, right? I guess an analogy would be, and I hope this doesn't offend anyone, my God, is that, the Titanic is going down and everyone is stressed out and freaking out, and some people are going to die. And there's a lifeboat, and you find yourself on, you think you're going to die, and you're swimming through the cold waters, and and many other people that are with you are drowning and dying. And you finally get to a lifeboat, and they let you in. But the boat, it seems very overfull. And then some other people start coming up and they're like, let me in the lifeboat. And you're just like, fuck you. So many people died just so I could get on this lifeboat. Like, no, if you get on this lifeboat, you could bring us down. Find another fucking lifeboat. Like, my life is already bad enough as it is. We could still die on this boat. Go somewhere else. I don't know if that analogy really fits for my conceptualization of what's happening, but I think it fits kind of. I think that's what it's sort of like, when you're stressed out and you're not given much and you're treated like crap, and then you finally eke out your little corner of safety, and then other people are trying to get into that corner, it can feel threatening and scary and it's unnecessary. You could be like, look, find your own corner, If you want to be asexual, fine, but identify as asexual somewhere else. Now, I just want to say that I don't know the data. I would suspect that most LGBTQIA people are totally cool with adding the asexual label. So that's my anecdotal experience. I don't know. But anyway, there is some infighting and some people that are barring entry into the community, and they're not letting asexuals in. So just thought I'd mention that. Okay, so let's look at gender and asexuality. There's some things I've already said, but let's look a little bit more closely at gender and asexuality. Some authors assert that gender is a big part of asexuality. As I talked about before, if you identify as a cisgender woman, or I guess if you identify in the research as a woman, any sort of woman, then you are more likely to be asexual. And among people who identify as asexual, somewhere between 60% and 2/3 of people that are asexual are women. So there's some speculation as to why that is. Why are women more likely to be asexual? Why are men less likely to be asexual? And there's a number of speculations here. I have three. Number one is these authors will assert that women's sexuality is more flexible than men's sexuality in general. So they will say that, in other words, women are more responsive to life circumstances. So, for example, if their relationship is going really well, then their sex drive might respond to that and go up. Whereas if their relationship is not going well, then their sex drive might completely die. Whereas, according to this speculation, men's sexuality and their drive and their libidos are less responsive to life circumstances and tend to be more consistent over time. And that's why more women and less men will be asexual. I find this to be possible, but I also anecdotally have not found this to be true. I see no difference between men and women when it comes to asexuality. I have had male clients who are asexual and female clients who are asexual, and queer, gender fluid people who are asexual. So I find it not useful to look at asexuality as more of a female thing. It's the same thing with, being borderline, for example, something like 2/3 or 70% of people with borderline are female. But in my experience, I've treated several men who have borderline, so I just don't really consider those distinctions to be very helpful, honestly. So, so there's that. And also, I find that this assertion, that women's sexuality is more flexible, I find that to be one of those arguments, those just so stories that seem to make sense given our cultural programming and not necessarily true in reality. The idea here is it's like, well, men are just horn dogs and they'll have sex anytime, anywhere. And women, they're like delicate flowers and everything has to be just right for them to want to have sex. And I just have not found that to be true. I do not find that cultural story to be relevant to actual people's lives. I have certainly worked with men who definitely need to have very particular circumstances in order to enjoy sex. And I've certainly seen women who could have sex anywhere, anytime, and do. So I just don't find that to be a useful thing. But anyway, that's what some of the literature is talking about. Number 2 is other authors will assert that women are not as socialized to think of sex as a marker of their worth. And they're also socialized to be less sexual in general in our society. So they're less motivated to cultivate sexual relationships with people. And so therefore a little more likely to be asexual. Whereas men are socialized to associate their masculinity deeply with how much sex they're having. So this speculation I could get behind. Women are absolutely socialized to be more prudent about their sexuality and not be quote unquote slutty. Men are absolutely socialized to associate their penis size and the amount of partners they have and how many women they can bag as a indication of how masculine they are. And so as a result of that socialization, you're, as a male, if you are kind of struggling with your libido, you might be more likely to sort of push past that or even just invent sexual urges that might not be there if they're not there. And whereas women are, if you're leaning towards asexuality as a woman, your self-worth is not necessarily tied to making that choice. So I could absolutely see that as being true. So according to this speculation, which I can get behind, it makes me wonder if we didn't socialize men and women differently in our society, might we see a more equal distribution of asexuality between men and women? Who knows? It's also possible, I know some of you are screaming at your phone right now, that the biological differences between men and women could play a role in the development of asexuality, higher levels of testosterone, blah, blah, blah. Certainly could be true. Going on your period every month doesn't really help sexuality necessarily. It can for some, but with others, it can be, it can add a lot of difficulty, cramps, and blah, blah, blah. So, you could see biological things being an influence as well. But anyway, number 3 is other authors will assert that asexuality can affect gender development. So the way in which people develop their gender identity might be affected by asexuality. So you could see a scenario where it's, take a teen boy who is developing sexually and he doesn't like sex. He doesn't want to have sex with other people and he really considers himself to be different than others. And so therefore he's like, okay, I'm a 13-year-old boy and all my friends are talking about sex all the time. And man, do I just not want to have sex? It just seems repulsive to me. Well, this might affect the way that you see yourself as a gendered person fitting in our society. You might be like, so if, real men want to have sex with women all the time, and I don't want to have sex with anybody, maybe that makes me not a real man. Well, then what am I? Well, maybe I'm trans, or maybe I'm non-binary, or maybe I'm this or that. So, because gender and the way we fit into society and how we view ourselves and our identities are, all affected by various different factors. Being asexual could be a factor in someone developing more gender fluid identities. For example, Brado et al. 2010 study found that 13% of asexual people did not identify as male or female. So that's a much higher rate than allosexual people. Again, for asexual people, 13% of them did not identify as a binary gender. So, makes sense. Another study found that trans folks have a much higher rate of asexuality, 4% as opposed to 1%. Now, some of you might be saying, well, maybe that's biological. Again, with the atypical prenatal environment, that could lead to both asexuality and transsexuality, or non-binary, gender feelings and identities. Could be hard to know, but I could see all being true, honestly. So that's another thing to just keep in mind that, as a demonstration of that, that's related, I suppose, is as I was growing up, I was in an all-white community for the most part. There were the occasional Asian person and the occasional black person, but it was just a vast sea of white people. And very, shall we say, white bread Americans, these aren't white. There were hardly any Jewish people. There were no white Europeans from England or Australia. It was very Americanized white people. So very monoculture. And I, being a half Japanese person, half white person, was quite exotic in that situation. Now, for the vast majority of my friends, they were not discriminatory or mean to me. But I definitely did feel different, especially when I was really young, when I was like fourth grade, fifth grade. I would look at myself in the mirror and I would just be like, I'm different. And I didn't like that. It felt bad. There's a lot of pressure put on kids to not stick out. And the things that I stuck out about, I did not like. I was taller than most people in my class, and I didn't like that. I tend to slouch even to this day because I don't want to be tall. I didn't like the fact that I was Asian. I didn't like the way my nose looked. My nose is a little Asian, and so I would try to make it longer and pointy. I would hold it in a point to try to make the nose like stay long. And there were just, my hair looked Asian at times, and I would try to make it not look Asian. And I wonder if that had an effect on my gender sort of notions, because throughout my life, regarding ethnicity and race, I've never quite felt like I fit in anywhere. Until I went to Hawaii when I was, first time I went to Hawaii, I was probably like 35 or something. And I was like, oh my God, I fit in here. It's the one place that everyone looks like me. Everyone is Hapa. Everyone's, half Asian or part Asian or different sorts of Asians and it's the only place in the world where I feel like I fit in. And so I grew up with this sense like I didn't fit in racially at all, anywhere. Even with Japanese people, I didn't really fit in because I wasn't fully Japanese, right? So I just grew up with the sense of like, I don't fit in. Well, when it came to my gender development, I think that affected how I developed how I feel about my gender. Now, I absolutely am cisgender male, but I also have a very strong connection to my quote unquote feminine side. I don't consider it a feminine side. I just consider myself to be who I am. And if society labels some of the things that I do as feminine, then great. But I don't see it as a feminine thing. Just like I don't see the fact that I played football a masculine thing. I just consider it a me thing. And so my, although I'm not trans or queer or gender fluid, although if I grew up today, I wonder if when I was younger, and still trying things on if I wouldn't have identified myself as gender fluid or more non-binary or something. Because I remember early in life just being like, I just don't understand why I have to be pigeonholed into masculine qualities. Like, why would anyone want to be limited in that way? And why are some of the things that I'm doing being labeled as feminine? Like, why can't I just be who I am? And so I wonder if being of mixed race, growing up in a monoculture white, community, made it so that I, in general, questioned a lot of constructs, including gender and how it applied to me. So in that way, it's analogous to if you grow up asexual, you might question a lot of things because you go through a period of time where you're questioning what society is telling us about sexuality. And you're like, well, what society is saying is that everyone is supposed to be obsessed with sex and everyone's supposed to enjoy sex. And if you don't enjoy sex, there's something wrong with you. And yet for me, I don't enjoy sex and I'm fine with it. And I don't feel like there's anything wrong with me. So society must be kind of dumb about some things. And maybe it's dumb about gender. And maybe I don't have to give in to the binary of masculine and feminine. So I think that that's a viable course for some people. Obviously, it's not for everyone, but I can absolutely see that being the case. When you start questioning one major institution in your society, I think it lends itself to questioning a lot of other major institutions in society. And so anyone who listens to this podcast knows that I tend to rail against institutions in our society and givens in our society. It's one of the most enjoyable things that I can do. I mean, I wouldn't say I have pleasure in it, but I definitely take to it. And I wonder if it all had the germination of all that began when I was growing up in a society, a monoculture, white American culture. And I was being told things about Asians. I was being told things about, half people. I was being told things about Japanese people and people of non-white ethnicity. And it was not checking with my reality. And therefore I was like, from a very early age, I thought, wow, some things in our society make no sense. I wonder what else in our society makes no sense. I'm not going to assume anything in our society makes sense, because at the age of 6, I realized society made no sense when it came to race. I didn't put it in those words, but I definitely detected it. I mean, I remember, because it was worse when I was a kid, right? I mean, World War II wasn't that long before I was born in 1970. And growing up in Issaquah, which is just a little bit east of Seattle, and have just the obsession that white people had about the fact that I was Japanese, or that my last name was Honda, or that, I don't know, I was half or something. There's just a lot of commentary on it. And some of it was fine, but some of it was just bizarre, like while I'm on this tip, I'll just say one last thing. When I was a kid, people were terrified of me. They were terrified of getting in a fight with me, particularly people who didn't know me. So I'd be, at the park or something, and some white kids would be messing with me, and I'd stand up for myself, and they'd all run. Not because I was tall, but so I'll just put a question mark there. Everyone out there, just take a guess as to why they would be terrified of me, just looking at me. Not because I was tall, because older kids were terrified of me too. If you younger people probably have no idea. You older people absolutely know the answer to this, which is that people assumed I knew karate or kung fu or taekwondo or something just because I was Asian, which I did not know. I grew up with a lot of siblings, and I begged my parents to sign me up for karate or something. It just seemed so cool, but they could only do so many activities with 4 kids, right? And I already was in, every sport. I played basketball, football, soccer, wrestling, volleyball, track, what else? I played all the sports. And so I think my parents were a little tired of driving me everywhere. And they had 3 other kids they had to drive around town. So I did not know anything about martial arts, and kids were terrified of me because they thought I was going to kill them. One of the benefits, I guess, of racism. Anyway, okay, let's go on to treatment. Let's end with treatment. And also, I'm going to read an email from a patron. Okay, so treatment. Let's look at medication first. The only medication that the FDA has approved for hypoactive sexual desire disorder. So this is not a medication for asexuality. Just like there's no medication for being gay, or there's no medication for being hetero, there's no medication for being trans, and there's no medication for being asexual. But there are medications for people who have hypoactive sexual desire disorder. And again, these are people, by definition, must have a significant amount of distress about the fact that they don't have desire for sex anymore, and they don't consider it to be an outside force that is forcing them to feel distress. They have internal distress. They don't like the fact that they don't have any sexual desire. Usually these people used to have sexual desire and they no longer do, or there's some medical explanation for their lack of sexual desire and they want to change that. And there's one medication that the FDA has approved, and it's called flibanserin, and it is sold under the trade name of, I don't even know how to pronounce it, Adyi, that the way it is spelled is ADD, so ADD, YI, Adyi. It's a terrible name. I don't understand drug companies and their stupid names for things, especially when you can't pronounce it. And this is, an American company coming up with the names. If this was like Indian or something, I'd be like, oh, okay, well, it must be pronounceable in their language. But this is an American company. And when they were asked why in the hell you came up with this name, a representative said, told a journalist, "We chose this unique name and spelling to represent the utility of the treatment and essence of the brand. It represents the individuality of the first of her kind and the definition of the woman's best self." So this is just a bunch of marketing bullshit. I mean, just listen to this. We chose this unique name, Adi. We chose this unique name and spelling to represent the utility of the treatment and essence of the brand. Okay, I don't know. That first sentence is just marketing gobbledygook. But this second sentence is just so ridiculous. It represents the individuality of the first of her kind. So they're calling the medication a her, which is just ridiculous. It represents the individuality of the first of her kind and the definition of a woman's best self. So let me explain what this drug is, and then you can fully laugh at this. So it's a medication that is called female Viagra on the internet, which is ridiculous. I don't think the marketers are calling it that, but people are calling it. You may have heard about it in the news. The medication is approved for the treatment of people with hypoactive sexual desire disorder who are premenopausal women. So women who have not entered menopause and who are experiencing a lack of sexual desire. And according to research, when they do trials, they find that, and listen to this very closely, they find that when people take this, so people will come in and women will come in, 30-year-old women, 40-year-old women will come in and say, I have no libido, and can you give me medication? And they go on this medication, and it increases, on average, the amount of satisfying sexual events, so not just sexual events, but satisfying sexual events, per month by an average of 1/2 over placebo. So when they compare they measure the success, according to the research, of this medication by the reported amount of satisfying sexual events that the women report. So they, pre-medication trial, they'll say, how many satisfying sexual events do you have in a month? And they, will say, oh, I don't know, like I have one satisfying sexual event per month, or I have 0 satisfying sexual events per month. And then after taking this medication, on average, they will say they have 0.5 more satisfying sexual events per month. So if they said 1, then they will say, I had 1.5 satisfying sexual events per month. So that's not a lot, right? That's not a huge change. And that's on average. That means that some people are experiencing no increase compared to placebo. Also, according to other research, they have found that this medication doesn't work at all for anybody. And other research finds that when this medication does work, it only works for 2 months. So the effect dies after 2 months. So the medication seems to be pretty useless. I'm going to guess that as we study this more moving into the future, that the effect size will be even smaller, even among the studies that find an effect. Because if early trials are finding such a small effect, then over time, as other more robust, more buttoned up research is conducted, typically what happens is you see the effect size going down. That's what happened with SSRIs. Early research found a certain effect size, and that effect size has just been getting smaller and smaller over time. It's a well-known phenomenon. So the so-called female Viagra, a pill that increases a female's libido, on average is pretty worthless. Now, for some people, could it be helpful? Sure. And I'm sure there are some people who have found success, but on average, it's not helping people. And there are side effects. People can, essentially, there's a lot of side effects related to lowering one's blood pressure. So this is actually interesting because it's the opposite of actual Viagra for men. Viagra will increase your heart rate and your blood pressure, and therefore, from what I understand, it makes erections more likely and more likely to sustain because you have more blood sort of pumping into it, from what I understand. And I think that, anyway, the point is that the opposite happens with the quote unquote female Viagra, where you have extremely low blood pressure and sleepiness and dizziness, and you might even lose consciousness. There are women who take Adderall or flibanserin and pass out upon taking it, which, can't be pleasant. Other medications, obviously, actual Viagra can be used to potentially, as a, you have a man, someone with a penis coming in and saying, I don't have any sexual desire. One easy thing to try is Viagra. Just say, well, how about, the next time you're thinking about having sex with your spouse, pop a Viagra half an hour before and see if that increases your sexual desire. Who knows? Maybe that'll help. Also, testosterone has been used for some people, for men and women. Increasing testosterone levels, taking a testosterone supplement can potentially help some people, but it from what I understand, it's not a very robust effect size in terms of helping people. So the long and the short of it is that for asexuality, there's no medication because there's no need for medication. There's no need for a treatment for asexuality. I just want to say that. But for people who lack sexual desire and want to have sexual desire, they want to explore that, you can try some medications, but that's probably not going to work. Sexuality and sexual desire is a very elusive thing. There are a lot of medications that can eliminate it, but we do not have a lot of things that can actually increase it. For some people, they actually will experience, some psychotropics will actually increase their libido. Libido is a very fickle thing. It can change with a variety of things, increase, decrease, stay the same, and it can be highly anecdotal for some people. But anyway, the predominant research points to not a lot of medication options for people when they lack sexual desire and they want to get it back. Regarding psychotherapy, the two identified therapies for lack of sexual desire is sex therapy, obviously, and forms of cognitive behavioral therapy. But for me, what I do with people, depending on where they're at in their exploration, typically, if someone comes in and they're saying, look, I have no sexual desire, or I have a couple that one of the members or even both of them say, we don't have any sexual desire anymore. The place that I go to is I actually point them towards the Asexual Visibility and Education Network, AVEN, which was founded 5 or 6 years ago and has thousands of members. It is the organization that does activism and education for asexuality. So I point people towards that website, and it's a good resource to explore. If you lack sexual desire, going to that might help. The thing that I tell people is there's a chance that you might actually find yourself identifying as being asexual. There's also a chance that you'll identify as someone who's allosexual and your sexuality is just being suppressed. But we have to explore that. We have to try that on. It's a similar exploration if someone were to come to me and say, I'm having a lot of sexual feelings towards people of the same sex, which really scares me because my religion says that I can't be gay. And with those people, I would say, well, let's explore it. Let's see what it means. It might mean that you're heterosexual. You might, after exploring this, say, you know what, I identify as heterosexual, and sometimes I fantasize about people of the same sex, but I don't consider myself to be gay or lesbian or even bisexual. Or you might find at the end of the exploration that you are bisexual or homosexual, but it requires a fair amount of exploration, and we can't just explore that sometimes on our own, because if we do that, we run the risk of allowing internalized homophobia or internalized asexual phobia, and which will affect our conclusions, right? If someone is just sitting alone at home and they're like, you know what, I haven't had any sexual desire for years. And that person has been programmed to believe that asexuality isn't a thing, or that asexuality is pathological or something. And so if they just start exploring their own ideas, those internalized, marginalized bias, things in their head might get in the way of them realizing who they quote unquote really are. So anyway, when people come to me who lack sexual desire, what I do with them is I say, well, let's explore it. Let's see how this goes, and let's maybe experiment, maybe try a few things, and we'll see what happens. But what I tell people is that we might find, again, as I was saying before, one of three things. At the end of this exploration and experimentation, you might find that you actually identify as asexual, meaning that you are cool with the fact that you have no sexual attraction towards other people, and that's how you want to live your life. You might also, at the end of the exploration, discover that you just had allosexuality that was being suppressed, and once we remove those barriers, you identify as allosexual, and you're living a life that is satisfying those needs. The third option is you might stay in a state of having low sexual drive, but still identify as an allosexual who has your sexuality being suppressed by one reason or another, or even reasons you don't really know. So there's a lot of options at the end, but all those depend on you. And I will collaboratively explore this with you, but I won't know the answer to that question. I can't top down as an expert tell you what you are. You're the only one who's going to be able to know that. In the same way that I can't evaluate someone and say, oh, you're gay, or oh, you're heterosexual. That's a personal choice that you have to identify for yourself. I'll be there with you, and I'll offer my opinion, I suppose, my tentative opinion about certain things. Or I might say, well, people who talk like that sometimes identify this way, but it's up to you. And I'll be there with you, but that's a personal choice that you make. So that's what I talk with people about as an introduction. And then we just go into their history. We go into their phenomenology. How do they experience sexuality? How have they experienced sexuality? We also go into what do they truly want with their sexuality? What are their goals in life? Do they care about sex? Do they want to be sexual? Or do they not? What's inside of them? Now, for some people, given their life circumstances, might lack a sense of self and might have a difficult time answering those questions. It might take years just for them to develop enough sense of self for them to be able to answer those questions, because you need a sense of self. You need to know who you are. You need to have an inner sense of who you are in order to answer such questions. That can be really quite deep. Some people, because of mistreatment, a lot of things in their life are determined by how other people treat them and what other people want for them. What careers people want them to go into. They don't think about themselves. They are reacting to what other people want for them. Who they should date, how they should dress, how they should think, what their political opinions are. Because they were treated a certain way, they might not actually know what, their own political opinions are, but they will adopt the political opinions of those around them. Well, in the same way, they might just adopt the sexuality that is being expected of them, right? And in order to find, quote unquote, their true sexuality, they need to enter therapy for a long time just to develop a sense of self, so that they can actually ask themselves and answer the question, who am I sexually? So that's another thing that I think about. With couples, it's a delicate process, because if you have a couple, one person comes in, or, one person in the couple is like, I want to have sex more. It's ridiculous. We're like roommates. We never have sex. And the other partner is like, you know what? I don't care about sex. I gave up on sex a long time ago. I don't know if I've ever cared about sex. And so with couples like this, it's a similar exploration. The person with low sex drive might, at the end of exploration, say, you know what, honey, I'm really sorry, but I am asexual. I don't care about sex. And if you want me to get into sex, I just don't think that's going to happen. And I am so sorry about that. Or at the end of the exploration, they might be like, oh my God, we found the barrier to my hidden allosexuality, and now we're having sex all the time. Or the third option is, at the end of the exploration, they might be like, okay, nothing has worked thus far to help me connect with my libido, but I still believe it's in there. I don't believe that I'm asexual. I'm not going to identify as asexual. I'm going to continue to try, or maybe I'll just accept the fact that my, submerged libido is just going to stay submerged, and but I'm not going to identify as asexual. And let's see what we can do here as a couple, that kind of thing. So when people want to change their libido, there are a lot of things that can be done. This is, pretty personal on things, but a lot of sexual education is usually necessary. There's a lot of, I've had some of the most educated, genius clients sit on my couch and not know one thing about sexuality. I mean, I'm exaggerating, but let's just say they know very little or have very regressive viewpoints about sexuality. Because where in the world do people learn about sex, right? I mean, where do people learn truly about sex positivity and about how to express yourself sexually for men and women, So it's not uncommon for highly intelligent, highly educated people to have some of the most adolescent viewpoints when it comes to sex. And so when someone has low sex drive, I often have to spend a good amount of time figuring out what is the most useful educational route to take with them, because we don't have a ton of time usually, and there's a lot of things to talk about. So sometimes it's a matter of assessing, okay, well, what educational area is going to be the most beneficial here? Also, another part of the exploration around asexuality versus allosexuality is advocating for non-shaming sex positivity, since most people have internalized shame around sexuality and their own sexuality. A good amount of changing that around towards sex positivity and non-shaming of the self. And that can involve a lot of cognitive therapy, a lot of narrative therapy, a lot of behavioral therapy. Like, go home, get a mirror out, look at your genitals, and get used to it. That's you. That's your junk there, and it's good junk. It's the junk that God gave you, and appreciate it. That is your vagina. That is your penis. It's a beautiful thing. I want you to look at it and take it in. That's you, and it's beautiful. That can be very powerful for some people. Now, for some, it doesn't really matter to them. But a lot of people just have so much shame about their genitals, or so much shame about the way they have sex, or so much shame about their bodies. My God, the amount of people who have shame about their bodies in our society, it's heartbreaking. 99% of Americans hate their bodies. It's just awful. And so that could be another massive barrier to arousal and enjoyment of sex, right? And libido, for that matter. I know so many people who, when they have an urge to have sex, the next thought they have is, well, but look at my body, I'm disgusting. And so, if every time you have an urge for sex, or if every time someone initiates sex with you, the first feeling and gestalt you have is a massive dose of shame about your body, well, guess what? Your libido is going to shrivel up and die. And so, with clients, we have to work on that, and that could take a long time. It's easier said than done. I can't just look at a client and say, like, stop body shaming yourself. Sometimes it takes a lot of conversations, a lot of couple work around, like, so what do you think of my body? Very honest conversations. Very typically, almost all the time, what spouses will say is, yeah, sure, you've gained some pounds since we first got married, but my God, I am still massively attracted to you. And, the little bit of extra pounds that you've gained, means nothing to me. Like, give me more of that stuff, is typically what people will say. Body shaming is such an individual internal experience that has nothing to do with reality often. Anyway, also just talking about liberation and about anti-oppression and marginalization and sex shaming and gender shaming and, shaming in general is an important part of the exploration of trying to connect with your true sexuality and your libido. Experimentation, assertiveness skills, etc. There's just a lot of different things that one can do. Again, when we're talking about treatment, we are not talking about how to treat asexual people. There's no reason to treat a content person who is totally cool with the fact that they have no libido. There is no treatment for that. No one should treat that, just like no one should treat gay people to not be gay. The only treatment we're talking about here is when people are confused about what they are, and or they absolutely are not confused about the fact that they have no sexual drive, they have no libido, and they have a tremendous amount of distress about that, and definitely want treatment to get that to be changed. So just to clarify about that. All right, so I want to end the podcast by reading an email from a patron who wrote in, which is the whole reason why I'm doing this episode, actually. I'll keep the email anonymous, and I'm going to kind of paraphrase some of the things here. I'm an aromantic person because I want a relationship. However, I can't ever feel the connection to the other person. Sex is something I have always been turned off by as well. I'm female, I'm 22. I've always been kind of distant when it comes to relationships. I've tried a few times to have a relationship, and none of them worked out due to me being independent and not wanting to hang out every day. I would find myself getting nervous all the time and not knowing how to respond to their texts. I also wasn't good at knowing how to act in public with them. The idea of kissing or doing anything other than hugging made me nervous. I've been sexually assaulted as an adult. I think you should know that. I often feel guilty that I don't seem to care if a guy breaks up with me. I just feel okay and relieved when he breaks up with me. Maybe it is related to my depression and anxiety, but I can't be sure. The same goes for sex in the way that I can take it or I can leave it. I don't want to have sex, but I feel like I owe sex to the other person. Okay, so let's review what this patron is saying. She's a young female adult. She has a sexual assault history. She says she's depressed and anxious, and she's turned off by sex. She has sex with partners because she feels like she owes them perhaps to keep them in the relationship, or she feels like it's an obligation or something. Also, she isn't interested in romantic relationships, and she often feels or always feels distant from other people. So it sounds like she could be asexual and could be aromantic, but only you, patron, can identify that as such. Only you are the one who can say whether or not you're asexual or not. Because you could, if it felt right to you, say, you know what, I'm asexual. I've never been interested in sex. I'm also aromantic because compared to other people, I don't think I'm very interested in romance. I feel like I'm just going through the motions. You can absolutely say to yourself, given what you're telling me, it would seem totally consistent. But you could also say to yourself, no, I'm not asexual and I'm not aromantic. I think I am a sexual person who has some barriers that's getting in the way of my sexuality. You could also say I am a romantic person, but there are barriers getting in the way of my true romantic self. You're the only one who knows the answer to that. You are depressed, you're anxious, and you've been sexually assaulted. Those three factors can absolutely present barriers to your libido and to your romantic, enjoyment or, urges. And some other factors that you talked about is you kept saying that you felt nervous about relationships and about sex. So it's possible that with a reduction in that anxiety, whatever that means, that enjoyment in sex and a drive for sex, a libido, and a drive for relationships might emerge. Because you're not a quintessential asexual, because a quintessential asexual, you might find yourself identifying as a quintessential asexual at some point. But quintessential asexuals, when they talk to me, they will say, I'm not into sex and I'm totally cool with it. And I've always been this way. And I don't care. I'm not distressed about it. I'm also not really into romance and I don't care, if they're both aromantic and asexual. Now, you might find again, after exploration, that that's how you feel about things. And therefore, it would be consistent for you to identify as asexual and aromantic. So, it's hard to say where you're at. You're the only one who can say. And what I would encourage you to do, patron, is to continue exploring that. Look at what barriers might be there that need to be removed in order for you to know. For example, with the nervousness, let's say you entered therapy or you entered a relationship that you really trust, and you really worked on that nervousness. You really came out and said, look, I don't know what is going on with me, but I kind of want to be in a relationship with you, but I also kind of don't really care. And I hope that's okay with you. Is it okay? Is that okay with you? And I kind of don't really care about having sex with people. I guess I'll have sex with you if you want, but I feel like I'm just acting like I care about sex when I don't really care about sex. How do you feel about that? Find someone that is cool with that and willing to explore that with you. Some people are totally cool with exploring that with you. And then if you can really feel safe and non-nervous and really assertive about yourself, and you can actually tell people, look, I don't want to do public display of affection. Look, I don't want to have sex anymore with you. I want to be in a relationship with you, and I want to hang out and have fun, but I don't want to have sex with you. I'm also not really into texting you back all the time. I can sort of not see you for a few days, and I'm cool with that. If you find a relationship like that, and you can really feel safe, and you can really feel non-nervous, then I wonder how you would feel. If after not feeling nervous, you find yourself feeling at peace and saying, this is perfect. I have a partner who I see once a week. We never have sex, and I don't have to text that person all the time, but we have a very, surface romantic relationship. That is like my perfect zone. You might find that that's what you like. You might be like, okay, well, it looks like I am asexual, and I am just barely romantic. I'm a one date a week romantic sort of person. You might find that to be true. You might also find that once you establish that kind of safety, that libido might emerge in you because the nervousness is no longer a barrier to that libido. You just don't know until you experiment. Now, having said that, you could say to yourself, I don't want to do that experiment, and I don't care, and I just want to accept who I am now. I don't care that I get nervous about that. Because that's the other thing, is it's possible that your nervousness is actually a result of you doing something that you don't want to do. You might actually be, quote unquote, truly asexual and truly aromantic, and you're trying to force yourself into a societal mode and expectations that other people have for you and society has for you. You've internalized these notions of the perfect life, or what makes humans human, and you're forcing yourself into a situation, and you're getting nervous because you're not in a safe place that is really meeting your needs. But it's hard to know. Given your email, I don't know, and I would love to hear what you find on this journey of exploration for you, and I would love to tell the listeners what happens for you. For the rest of you, let me know what you think. I know we have a lot of asexual listeners to the podcast. Hopefully I didn't say anything stupid or offensive. And if I did, I apologize. Let me know what I did. I am always glad and invite learning for myself in terms of foibles that I might get into. And I hope that if I did offend, that you trust that I was giving it my best shot and hopefully advocating in a good way. I don't know, though. Let me know, because this is the first sort of extended conversation or deep dive that I've had about asexuality. Before really doing a deep dive on this, it was a lot of the details about this were unknown to me. And so it's been kind of a crash course, and, let me know what you think. Email me at contact@psychologyinseattle.com. That's contact@psychologyinseattle.com. Again, become a patron of the podcast if you like stuff like this, particularly if you like it when I advocate for these sorts of things. As I was talking about earlier, I think when we get more and more patrons, I get more and more time to dedicate to these things, and I can actually potentially become a spokesperson on some level. I can reach out to media outlets and say, like, look, if you need someone to advocate for mental health awareness or for LGBTQIA issues as an ally, or, whatever sort of political thing that I get behind. I will often talk about incels and, men's rights activists, these kinds of people, feminism. I want to actually get maybe a little bit more intentional about my political actions. And I'd love for people to become patrons to support that if you care. And also, I guess another thing is, patrons out there, let me know what sort of advocacy you'd like me to do. I am absolutely open to suggestions like that. One could say that a lot of the directions that I've taken on the podcast have been due to people writing me and telling me what to talk about. Like today, I'm talking about asexuality because a patron wrote in, and others saying that they wanted me to talk about this. Otherwise, I probably would have never talked about it. So it's a community. I'm working with the listeners, and so, just let me know. Thanks for joining me, and please take care of yourself because you deserve it. You really, really do.